Testing 1, 2, 3, 4, 5, 6, 7, 8. Testing 1, 2, 3, 4, 5, 6, 7, 8. Mic check from finance. Testing 1. Testing 1, 2, 3, 4. Now, okay. Yeah, I'm still here. Testing 1, 2, 3, 4, 5. Can you hear me right now down there? Okay, hold on. Okay.
The committee will come to order. Without objection, the chair is authorized to declare a recess of the committee at any time. This hearing is entitled Homeless in America, Examining the Crisis and Solutions to End Homelessness. I now recognize myself for 3 minutes to give an opening statement. Today, this committee convenes for its first hearing of the 116th Congress. This hearing is on an extremely important subject, the national homelessness crisis. Today, there are over 500,000 people experiencing homelessness nationwide, and nearly 160,000 of them are children. Nearly 38,000 are veterans who we have failed to support after their service to our nation. The number of people experiencing chronic homelessness nationwide increased between 2017 and 2018. In Los Angeles County, there are over 50,000 people experiencing homelessness, nearly 5,000 of whom are children, and over 3,800 of whom are veterans. In the richest country in the world, it is simply unacceptable that we have people living in the streets. This is a crisis that requires action. I had my staff look at this committee's hearing records, and it appears that this is the very first time that the full committee has convened a hearing focused entirely on homelessness. So it is long overdue for this committee to turn its attention to this crisis and consider proactive solutions to ensure that every American has a safe, affordable place to call home. This is a top priority for me as chairwoman. We need Congress to have the political courage to step up and provide the resources and funding necessary to end homelessness. And the first step is to put forth proposals to address the problem and have a discussion. My bill, the Ending Homelessness Act, provides $13.27 billion in new funding over 5 years to federal programs and initiatives to prevent homelessness. It includes funding for new units of affordable housing, new vouchers, case management, and technical assistance. Today at this hearing, we will hear directly from experts and advocates regarding the continuing challenges in tackling homelessness in America and their recommendations on solutions. Before I yield to the ranking member, I would like to just take a moment to note the presence of Representative Katie Hill, the former executive director of the largest nonprofit in California that advocates for people experiencing homelessness. She also served on the governing and oversight body for the Los Angeles Continuum of Care, overseeing the use of federal homeless assistance funding, and she was instrumental in recent initiatives that will provide substantial new state and local funding homelessness in Los Angeles. The chair now recognizes the ranking member of the committee, the gentleman from North Carolina, Mr. McHenry, for 4 minutes for an opening statement.
Well, I want to thank Chairwoman Waters for hosting and bringing us together to talk about a really important issue for our country, for my home state in North Carolina, and for, I think, everyone's district represented here on this committee. And so I do think it's important that we highlight the need for a more concerted effort to combat homelessness. You know, according to the most recent data in 2018 that Chairwoman Waters highlighted from HUD, we have 552,830 of our fellow Americans that are homeless. Of that, nearly 10,000 are from my home state. Every state's touched, every community is touched by this. And while this represents a significant decrease since the first homelessness count in 2005, that count was 754,000. There's a dramatic reduction in homelessness from the initial count. But still, until we solve this problem, one is too many. And so I also want to highlight another subset of that large group, 194,000. 194,487. That number represents the total number of people who are also unsheltered, meaning they're living in vehicles, tents, other makeshift dwellings in a variety of different places. And so I'm very interested to hear the testimony, not just on the problem, but on the solutions. What we can do as federal policymakers in concert with state and local officials to make sure that we have a proper response in dealing with this challenge. There's also another demographic group of that, the chronically homeless because of alcohol or drug addiction or mental illness, the victims of domestic violence who need a safe haven, the veterans who are out of his or her luck after serving our country, working families who cannot afford to live in the communities where they work, and the youth, whether those not living with families or those who are recently graduated who are trying to find shelter. And so today I hope that this will be the first of a robust discussion on this issue, where we can review all the programs under the Department of Housing and Urban Development and across our government as much as we can to determine if they are effective in addressing the homelessness challenge that we face across our nation. Additionally, we should explore new initiatives to engage the federal, state, local, nonprofit, and private market shareholders to develop holistic approaches that understand the humanity that's at risk here, the people and the challenges they face, including eliminating state and local barriers to affordable housing, and increase the supply of affordable housing. And while appropriate, we should, and where appropriate, we should explore how to allow localities the flexibility to tailor specific solutions to address the concerns that may not fit a federal one-size-fits-all approach. And so I look forward to the testimony and the questions today, and with that, I yield back.
Thank you very much. I will now recognize the subcommittee ranking member, Mr. Duffy, for 1 minute.
Thank you, Madam Chair. It's good to see you. Welcome, panel. I'm over here, your upper left-hand corner. I think this is a great hearing. As the chairwoman knows, and Mr. Cleaver knows, we've spent a lot of time working on homelessness, and specifically rural homelessness. And I think we have to have a broader conversation about what programs work and what programs don't work as well, and where do we streamline resources into the programs that help the most people. How much money do we spend to eradicate homelessness? And I'm proud that this committee has worked well together, maybe not on everything, but on homelessness, we actually did work well together. We passed the Family Self-Sufficiency Act. We did the Housing Choice Voucher Program. We did a lot of work trying to help those young people who are foster children who have a high propensity to go into homelessness. How do we direct them into housing so they don't start their adult lives off homeless? And I'll just say I want to thank Ms. Roman for coming to my district for a Homelessness and Hunger Summit. I'm grateful for that. The Secretary of HUD came to my district as well, and I have an open invitation to the chairwoman to also come to my district and discuss rural homelessness. I yield back.
Thank you very much. I now recognize the gentlewoman from New York for 1 minute, Ms. Maloney.
I want to thank Chair Lady Waters so much for holding this hearing. We have not had a full committee hearing on homelessness in many, many years. So I am thrilled that this committee is having its very first hearing on this important issue. Homelessness is an enormous problem in this country. Nearly 1 in 7 people experiencing homelessness live in New York City, which I am privileged to represent, and it's a problem that demands immediate solutions. Roughly 78,000 people in New York City are homeless, yet New York City has one of the lowest rates of people that are homeless that are not sheltered. Only 5% of this 78,000 do not have a sheltered home. But we need to do far, far more. I am very pleased to be an original co-sponsor of the Chairlady's Ending Homelessness Act, which would provide over $13 billion in programs, the same as an aircraft carrier. Let's get our priorities straight.
I will now recognize Mr. Cleaver from Missouri.
Thank you, Madam Chair. I would like to thank you for having this hearing, and I think Ms. Maloney mentioned the uniqueness of dealing with this issue. But at the same time, I appreciate Mr. Duffy's work with me on the Housing Choice Voucher Mobility Demonstration Act. Tragically, I think we are precipitously moving toward the notion that we can do nothing about homelessness. And if we're going to have any discussion about homelessness, it will inevitably lead us to the discussion necessarily about affordable housing. We are in a crisis on affordable housing, and what I hope everybody understands is that as we remove affordable housing, it leads to homelessness. And so we've got to deal with that issue if we're going to deal with homelessness, and this is a good start. Thank you, Madam Chair, for this hearing.
Thank you very much. We will now move to our witnesses for today. We welcome the testimony of Ms. Carolyn Darley, Speaker Advocate with the National Coalition for the Homeless, Dr. David Lucas, Postdoctoral Research Fellow with the Institute for Entrepreneurial Society, Whitman School of Management at Syracuse University, Ms. Nan Roman, President and CEO of the National Alliance to End Homelessness, Ms. Anne Marie Oliva, Senior Policy Advisor with the Center for Supportive Services, Mr. Justin Rush, Public Policy Director for the True Colors Fund, and Mr. Joshua Stewart, Director of Policy with the National Coalition for Homeless Veterans. Without objection, your written statements will be made a part of the record. Ms. Darley, you are now recognized for 5 minutes to give an oral presentation of your testimony. Ms. Darley, is your microphone on?
Okay, thank you. Good morning, ladies and gentlemen. It is my pleasure to be here. I'm from the National Coalition for the Homeless. My name is Candy Darley. And what we do at the National Coalition for the Homeless through our Speakers Bureau, of which I am a part of, is to tell our stories far and wide, because we break the myths and the stereotypes as to what causes homelessness. As the gentleman before me said, I almost nodded my head off because affordable housing, or the lack of it, is the #1 cause of homelessness. And the stereotype is that the lower classes, or the uneducated, or the mentally ill, we like to call it the lazy, crazy, and drug addicted. But I beg to ask any one of you all if you might know someone who lives in a home that still experiences those three things. It is not a problem that only the individuals who are homeless experience, and I'd like to make that a point quickly. My personal story is such that I never saw homelessness in my future, and I had preconceived notions as to who and what the homeless were until it happened to me. I happened to become ill and then suffer a divorce in almost the blink of an eye. And before I knew it, I was at a shelter. I didn't even know shelters existed. And the individuals that I thought that I would meet there, let's just say my expectations were shattered. There was a doctor there that had fell on hard times, and she went to work every day at Georgetown Hospital. There was a journalist there from the Washington Post, and a few other individuals that you would not have expected. Because, see, homelessness does not discriminate against anyone. I'd like to say that the Housing First program is the thing that saved me. In Housing First, it is designed for individuals who are homeless to get a place that is then subsidized until they can do better, or if they have diagnoses as illnesses or dual diagnoses such as mental illnesses, they get an opportunity to stay there for life. Now, the thing that I noticed being a recipient of that program is that we're viable members of society. Many people go on to work towards advocating for homelessness and poverty in general. And it surprised even me. I remember speaking to a group of individuals at Villanova University, and the gentleman hearing my story could not contain himself. He's like, she's just like us, you know? And I don't know what he expected, but yes. We also shouldn't forget that with the disasters that are befalling our country, that these disasters also bear people towards homelessness. You know, I believe the statistics is 10% of the individuals who become homeless from fire, flood, or whatever natural disaster have you stay that way. And we have to do something about that, all right? Because when the individuals that make up this country, the middle class, falter, this country falters, and we can't afford that. We really can't afford that. So I'd like to say something that I've always said whenever I speak to people, and it's this. I believe that the opposite of wealth was poverty. It's not until I experienced this myself that I believe and now understand that the opposite of poverty is justice. I urge the robust conversation on this topic. I urge it. It is happening to more and more individuals as time goes on, and you'd be surprised at the individuals that I speak to all over the world and all over the country that say the same thing. So if we could get a handle on that by starting this conversation, it would be great. Again, it's my pleasure to be here. I thank you, and I urge all questions or any questions afterwards. I'd be more than happy to help. Thank you very much.
Thank you, Dr. Lucas. You are now recognized for 5 minutes to give an oral presentation of your testimony.
Good morning, Chairwoman Waters, Ranking Member McHenry, and members of the committee. Thank you for inviting me to testify today. My research focuses on analyzing efforts to end homelessness in our nation, and so I'm honored to speak with you on this topic. My present testimony cannot address all of the intricacies of this very important issue, but I can speak to 3 considerations based on my research and on the available evidence. The first point is that we do not yet know how to end homelessness. Second point, the homeless problem varies widely across communities and individuals, reducing the likelihood of a universal solution. Third, allowing service providers more flexibility to experiment, paired with the prioritization of performance data, will facilitate a more compassionate, more effective, and a truly evidence-based response. It is often said that we know what works to end homelessness, and the premise of this claim is that we have a sufficient evidence base to solve homelessness, specifically via Housing First. It is true that there are at least 3 acceptably rigorous studies that found that clients entering Housing First programs had higher rates of housing retention, they stayed housed, relative to other shelter programs. Importantly, however, these studies have only dealt with individual level outcomes. They tell us what happened to individuals or families who entered these programs relative to existing alternatives. But by construction, these studies do not demonstrate whether further implementation of the Housing First approach or related subsidies would end or even reduce homelessness in the aggregate. That is the important policy question, and actually the answers to this question are somewhat less promising. From 2009 to 2018, the federal government significantly increased annual homelessness funding to over $6 billion a year in 2018. This funding helped double the availability of housing subsidy-based programs for the homeless, adding 142,000 permanent supportive housing beds and 100,000 rapid rehousing beds nationwide. But over this period, unsheltered homelessness only declined by 32,000 people. Of course, these numbers don't tell us what, if any, causal role these targeted efforts had in reducing homelessness. Economists, including myself, have estimated the effects of federal homelessness funding and of permanent supportive housing beds on communities nationwide to determine whether they reduce the amount of homelessness, and controlling for other factors like housing market conditions, unemployment, or climate. Kevin Corinth found that communities required at least 10 additional permanent supportive housing beds to reduce homelessness by just 1 person. In my research, I found that federal homelessness funding over this period had no effect on the prevalence of unsheltered homelessness across communities in recent years, despite evidence-based practices mostly and increasingly being funded. Columbia University's Brendan O'Flaherty recently summarized the state of the literature as follows: we don't know how to end homelessness, not in the aggregate anyway. So why would large increases in housing subsidy-based programs like Housing First yield small reductions in homelessness? Well, one answer is that supplying permanent housing subsidies through the shelter system tends to increase shelter entries. But another important factor is that local conditions influence the nature of homelessness in a community and, in turn, the effectiveness of different approaches. Unsheltered homelessness, for example, is largely concentrated in warmer climates, while sheltered homelessness is more prevalent in colder places. These populations are very different on average. The prevalence of homelessness also varies considerably in communities with similar climates, suggesting the importance of state and local policies. For instance, land use regulations reduce the availability of affordable housing, and they positively predict homelessness at the local level. Local tenant rules affect the incidence of eviction, which is a common precursor to shelter entry. On the other hand, strong communities may foster the prevention of homelessness. A recent study found that people with strong social ties to family, friends, and religious groups were 60% less likely to experience homelessness in the first place. Formal prevention programs have also been highly successful in New York City and Chicago. These examples suggest further solutions that go untried and untested in a system that focuses solely on long-term housing subsidies like Housing First. If it were a settled fact that the Housing First approach were the solution to end homelessness, the principal obstacle would be securing enough funding. However, it's unlikely that increasing funding for this or any one-size-fits-all approach will achieve that desired goal. Since many of the barriers to housing stability are local or individual in nature, this suggests the effectiveness of different programs across communities and across homeless subpopulations. I suggest that rather than mandating the proliferation of a single top-down approach, we increase organizations' flexibility to use existing scarce resources toward innovative efforts to alleviate homelessness in their specific communities. We should continue to invest in the collection of data on organization and community performance at addressing homelessness and allow these data to inform future funding decisions. Together, this would encourage the discovery of innovative solutions to homelessness that are tailored to local conditions and client needs and lead us to a more compassionate and evidence-based response. Thank you.
Thank you, Dr. Lucas. Ms. Roman, you are now recognized for 5 minutes to give an oral presentation of your testimony.
Thank you so much, and thank you, Chairwoman Waters, for convening this hearing. The National Alliance to End Homelessness is honored to appear before the committee today. Homelessness, as has been stated, is a very serious problem in communities all across the country and of all types, urban and rural. It's a complicated problem, but it is driven by the gap between rental housing costs and what low-income people earn. It's also exacerbated by racism, including in feeder systems such as the criminal justice, child welfare, and health systems. People often become homeless after a crisis that has economic implications, such as a health emergency, eviction, and divorce. Support networks, including family and friends, are a buffer against homelessness. People often become homeless when they lose their support networks because they move or because those support networks are simply too under-resourced to help them. Given the increasing cost of rental housing and the widening gap between those costs and what lower-income people earn, we might reasonably expect that homelessness would be growing in the nation because it's the feeder systems into homelessness and people coming into homelessness is the reason the number is going up. And indeed, there is evidence that more people are becoming homeless. Yet the number of homeless people, people who are homeless at a point in time, is not growing, as been pointed out. It's decreased since 2007 in over half of jurisdictions, including many of the jurisdictions of the members of this committee. The reason is that we do know what to do to end homelessness, which is basically to get people back into housing as quickly as possible and connected to supports in their communities. And communities are getting better and better at doing that by learning from each other's innovations. There's not a one-size-fits-all approach, like Housing First, which is not a single approach, and low-barrier shelter, and using federal resources to support those innovative solutions that communities come up with. A good example is a success in cutting veteran homelessness by more than half. Good things have happened, definitely, but so much remains to be done. I want to bring up a few of the issues we see coming. As was mentioned, 35% of people who are homeless are unsheltered, a much higher percentage of adults, single adults. This is completely unacceptable in a nation such as ours. Recent data show that unsheltered people are much more likely to be disabled and to stay homeless for long periods of time. While shelter is not a solution to homelessness, no one should sleep outside. This is a crisis that we do need to address. African Americans, Native Americans, and increasingly Hispanic and Latinx people are disproportionately homeless. The homeless system by itself cannot solve that problem of disproportionality, but it should add to it by treating people differently on the basis of race. HUD has incentivized communities to examine their homeless systems for disparities and to plan to remediate any disparities they find. Many groups, including our own, are helping with that. This is critical work and needs to continue. People who are housed are not homeless. The faster people get into housing, the better they do, and that is basically the simple premise of Housing First. It does, however, often take people quite a while in housing to solve their problems. Every homeless program in the country does not have to take a Housing First approach, and HUD does not require that they do so, but not to house people who are still struggling with mental illness, with substance abuse disorders, and with extremely low wages just means returning the most vulnerable people to the streets. People who receive assistance do have responsibilities, as do the programs that assist them. But Housing First is working to reduce homelessness, and we should continue to support it. The homeless population is aging fast, and this will generate significant health care costs, especially to nursing homes. The committee is urged to consider whether housing support focused on the aging homeless population would not only be right, but be cost-effective. The U.S. Interagency Council on Homelessness has done a wonderful job coordinating the 19 federal agencies that help homeless people across the various dimensions of housing, behavioral health care, employment, and more. It leverages far more impact than its budget of less than $4 million a year. USICH should be permanently authorized and adequately funded. Finally, several pieces of legislation to address homelessness and/or housing are under consideration by the Congress. The Alliance is generally supportive of all the legislation that we've seen, and particularly points out that the Ending Homelessness Act of 2019, introduced by Chairwoman Waters, proposes a two-scale level of funding and addresses the problem across the board and seeks to end it. It would be very important for the committee to advance bills that both make fixes and create a vehicle that could make a dent in homelessness. We do know what to do. We just need to do more of it. Thank you so much to the committee for inviting the Alliance to testify.
Ms. Oliva, you are now recognized for 5 minutes to give an oral presentation of your testimony.
Great, thank you so much. Again, my name is Ann Oliva. I'm the Senior Policy Advisor at the Corporation for Supportive Housing, or CSH, and I want to thank the committee for inviting me to testify today on this incredibly important topic. We all know that solving homelessness isn't easy. Communities across the country are struggling to make decisions about how to best use their scarce resources and to build the right mix of interventions, from prevention to supportive housing and everything in between, so that they can address the specific needs of their communities. Knowing which types and how much to invest in each intervention when most communities don't have enough of any single resource can be incredibly challenging. What we know about people experiencing homelessness today points to both challenges and solutions. In 2018, we saw increases in both unsheltered homelessness and chronic homelessness. And a recent study released by the University of Pennsylvania indicates that the homeless population, as Nan mentioned, is aging, and with an older population comes higher costs. People experiencing chronic homelessness are particularly vulnerable due to the length of time that they've lived on the streets and the disabling conditions that they face. Research shows that supportive housing, which is permanent housing with services designed to meet the specific needs of tenants, cost-effectively ends chronic homelessness. Costs on average are reduced by 49.5% when people move from the streets and into supportive housing. And although as a nation we've invested in over 300,000 units of supportive housing since 2009, we're not nearly where we need to be to address this growing homeless population that's getting older and struggles with multiple challenges. Decreased federal investments in supportive housing have made the situation even more difficult for communities. We must invest more so that we can get back to making the progress we know how to make. And we need to continue to innovate and create avenues for individuals who are ready to move on from these programs. But implementing these move-on strategies is difficult when affordable housing is scarce. Tight housing markets are impacting both the number of people experiencing homelessness and the ability for homeless systems to exit people successfully. A recent report by the Zillow Group showed that communities where people spend more than 32% of their income on rent can expect a more rapid increase in homelessness. Homelessness is also impacting families across our country. In 2018, there were more than 180,000 persons in families experiencing homelessness on a given night. And for these families, we also know how to end their homelessness. The Family Option Study concluded that housing subsidies for families experiencing homelessness resulted in increased housing stability and had other significant benefits in family and child well-being. For high-need or child welfare-involved families, resources like the Family Unification Vouchers can provide the right level of subsidy and support to help families become stable. For young people experiencing homelessness, we have to continue to support efforts like the Youth Homelessness Demonstration Program so that we can build systems responsive to youth needs and that provide equal access for young people who are disproportionately comprised of youth of color and LGBTQ youth. It's clear that homelessness cannot be solved by the homeless system alone. CSH works in communities and across systems because life doesn't happen in silos. People don't interact with just one system. The challenge that local public agencies face requires coordinated and smart approaches. This type of cross-system collaboration is also important at the federal level. The 47% decrease we saw during my 10-year tenure at HUD in homelessness among veterans was not a coincidence. It was the result of hard work across agencies and in communities to make sure that we were aligned in every way. The U.S. Interagency Council on Homelessness was a critical partner in this work, and CSH supports the Working Together to End Homelessness Act of 2019, which permanently authorizes USICH. As a country, we can't afford to simply implement short-term fixes or require people experiencing homelessness to be housing ready to qualify for housing. This is why it's so important that we continue to support programs that use a housing-first approach. Housing first is not housing only. Once the basic need of housing is addressed, then services can work with program participants to help them achieve their health, sobriety, employment, and personal goals. In a housing-first approach, people are treated with dignity and respect and are offered the services that they need and want to become stable. We know that we must both stem the inflow into homelessness and increase the outflow out of homelessness by making strategic choices like partnering with child welfare and developing solutions for justice-involved individuals. We must also recognize that people of color are disproportionately impacted by homelessness and work to dismantle the structures that lead to these inequities. Because the Ending Homelessness Act of 2019 recognizes all of this, empowers solutions to homelessness, and commits the federal government to many of the smart investments I've discussed, CSH supports it. Thank you so much for the opportunity to be here today.
Thank you very much, Mr. Rush. You are now recognized for 5 minutes to give an oral presentation of your testimony.
Thank you for the opportunity to testify today regarding homelessness in America. My name is Justin Rush, and I currently serve as the Director of Public Policy at the True Colors Fund, co-founded in 2008 by Cindy Lauper, which works to prevent and end homelessness among lesbian, gay, bisexual, transgender, queer, and questioning LGBTQ youth, seeking to create a world where all young people can be their true selves. To put our mission into action, the True Colors Fund provides training and education opportunities for communities and service providers, engages members of Congress, state houses, federal and state agencies, and authentically collaborates with youth who have experienced homelessness to provide innovative solutions to addressing the youth homelessness crisis. Consideration of the issue of homelessness in the United States could not be more timely, particularly as it pertains to our nation's most impacted. An estimated 4.2 million youth and young adults up to age 24 experience homelessness each year in the United States. Annually, 1 in 30 youth ages 13 to 17 and 1 in 10 young adults ages 18 to 25 endure some form of homelessness. LGBTQ youth have a 120% increased risk of experiencing homelessness compared to youth who identify as heterosexual and cisgender. African American youth are also overrepresented, with an 83% increased risk of experiencing homelessness over youth of other races and ethnicities. Additionally, Latino and Latino youth make up 33% of 18 to 25-year-olds reporting homelessness, with African American youth, especially young men aged 18 to 25, who identify as LGBTQ, reporting the highest rates of homelessness. Nearly 1 in 4 African American young men ages 18 to 25 also identify as LGBTQ, reported homelessness in the last 12 months. According to our service provider report, LGBTQ youth made up 33% of young people accessing homeless services. LGBTQ youth of color, particularly transgender youth of color, are more likely to experience violent crime, including sexual assault, police violence, robbery, and murder. Homelessness makes them even more prone to experiencing these traumatic events. Additionally, LGBTQ youth of color are more vulnerable to discrimination in education, employment, housing, and are more likely to be involved in the criminal justice system. Institutional racism, homophobia, and transphobia contributes to pathways into homelessness for these young people, and it stymies their ability to exit homelessness. Furthermore, transgender people report high rates of discrimination that contribute to their housing instability, which also deters them from accessing services with, according to one study, nearly a quarter of transgender adults surveyed reporting experiencing housing discrimination related to their gender identity. We are thankful to the committee for undertaking legislation that seeks to address the homelessness crisis within our country. Specifically, we support the Ending Homelessness Act of 2019, which would amend the McKinney-Vento Homelessness Assistance Act to make significant additional appropriations available for emergency relief grants, rental assistance for households and individuals who are experiencing homelessness, and homelessness outreach and coordination services. The bill also permanently authorizes the U.S. Interagency Council on Homelessness, which has been integral in coordinating our nation's response to the crisis. To be certain, preventing and ending homelessness means that Congress should ensure equal access to HUD-funded programs by providing legal protections based on one's sexual orientation and gender identity, and ensuring all continuums of care providers receive training for LGBTQ cultural competency and linguistically appropriate services for those most impacted by the homelessness crisis. Preventing and ending youth homelessness means providing targeted programs with few to no programmatic prerequisites for permanent housing with low barrier admissions policies, rapid and streamlined entry into housing, supportive services that are persistently used to engage tenants to ensure housing stability, with all tenants having full rights and legal protections, especially transgender and gender nonconforming people. Most importantly, it means elevating the voices, experiences, and expertise of youth who have experienced homelessness and including them in all aspects of the planning and implementation process of programs and initiatives designed to prevent and end youth homelessness. Congress has laid the groundwork on this issue and should continue its support of the Youth Homelessness Demonstration Program, which brings together continuums of care and youth who have formerly experienced homelessness to provide technical assistance and capacity building towards implementing local plans to prevent and end youth homelessness. Thank you for the opportunity to testify today, and I look forward to your questions.
Thank you very much, Mr. Stewart. You are now recognized for 5 minutes to give an oral presentation of your testimony.
Thank you. Chairwoman Waters, Ranking Member McHenry, and distinguished members of the House Committee on Financial Services, my name is Joshua Stewart. I'm the Director of Policy for the National Coalition for Homeless Veterans, or NCHV. The good news is that since June of 2014, 66 communities and 3 states have achieved the federal benchmarks and criteria for ending veteran homelessness. This is an achievable goal. We've seen the annual point-in-time count across the country of veterans experiencing homelessness decrease by 48% since 2009. That said, with 37,878 veterans experiencing homelessness on a given night, we still have much work to do across the nation. We need to maintain our efforts to ensure that homelessness is rare, brief, and non-recurring for veterans and for all Americans. We have been making dramatic strides in the last 10 years, and there is every indication that we will continue to make progress if we don't lose focus. For Congress, this means ensuring that key programs that serve veterans experiencing homelessness are sufficiently funded and receiving sufficient oversight. The latter task is being accomplished here today at this hearing, and we thank you for examining the wider issue as well as including the veteran population in that examination. For the former, we at NCHV do not advocate for the unqualified growth of resources for the sake of expanding programs. Rather, we base our recommendations on evidence from the field and on national level data. For the administration, this means keeping the issue of veteran homelessness a top priority among the leadership of VA so that they may continue to be a strong partner to HUD. Furthermore, the administration should strongly support the United States Interagency Council on Homelessness, or the USICH. From President Reagan to Secretary Jack Kemp on to the leadership of current Director Matthew Darley, the USICH has been at the forefront of strategic planning, effective and efficient resourcing, and the sheer hard work of interagency cooperation. It has had a long history, but it has never been as effective as it has been over the last decade and as it is now. We must not lose the USICH. NCHV asks that Congress pass legislation in the 116th to make USICH a permanent part of our system. Another critical aspect of our work to end veteran homelessness is the HUD-VASH program, which pairs a HUD-funded affordable housing voucher with VA case management services. Congress has been very generous with the creation of new HUD-VASH vouchers since 2008 to great effect. The simple fact remains, however, that there is still much unmet need across the country. A recent survey of NCHV members indicated that 86% of our respondent communities still had an unmet need for permanent supportive housing and a wait list for HUD-VASH. As such, NCHV is calling for more investment in the HUD-VASH program, both on the tenant-based and project-based sides, coupled with improvements to case management and a smart, measured approach to recapture and disbursement of underutilized vouchers. I'd also like to say a few words about an often overlooked portion of the veteran population. Veterans who received an other than honorable or OTH type of discharge from military service are in practice, though not in law, usually ruled ineligible for VA healthcare or other benefits. This is true even though many studies in recent years have shown that a large portion of OTH discharges are the result of service members' behavioral changes due to repeat deployments or unaddressed post-traumatic stress. Despite a single-digit percentage of America's veterans receiving an OTH discharge, they make up 15% of the homeless veteran population. NCHV strongly supports the Veteran House Act of 2019 before you today. In communities where the most progress has been made, several common themes exist. All those communities made the mission central, prioritized services based on acuity, increased investments, aligned with Housing First principles, remade their systems, and created or leveraged affordable housing. The Ending Homelessness Act of 2019 takes those commonalities as the core of the bill's approach to ending homelessness. NCHV can vouch for their successfulness. Perhaps the two most important things that we've learned from our work to end veteran homelessness is that it is possible to end homelessness in a community and that it cannot be done without adequate stocks of affordable housing. This bill acknowledges both of those realities, and as such, NCHV is proud to support it. Thank you for the opportunity to present testimony at today's hearing. We look forward to working with the House Committee on Financial Services to ensure that any veteran facing a housing crisis has access to safe, decent, and affordable housing and the supportive services required to maintain it. Thank you once again, and I look forward to your questions.
Thank you very much. I now recognize myself for 5 minutes for questions. And I'm going to direct my question to Ms. Oliva, Center for Supportive Services. Ms. Oliva, the most recent HUD data on homelessness shows that we saw an increase in people experiencing chronic homelessness between 2017 and 2018. These are people that have a mental illness or disability that has contributed to their inability to remain stably housed for an extended period of time. People experiencing chronic homelessness make up about a quarter of all people experiencing homelessness in the Los Angeles metro area, including over 600 children and youth. I'm concerned that these families and individuals cannot effectively get access to the support they need without intensive case management. What do we know about the best strategies for addressing chronic homelessness and the role of social workers? The U.S. Interagency Council on Homelessness plays a critical role in our federal strategy to end homelessness, but if Congress does not extend its sunset, the authorization for USICH will expire at the end of funding year 2020. Last year, I was an original co-sponsor for a bipartisan bill that would permanently authorize the USICH. Can you talk about why the role of USICH is so important and how the termination of USICH would affect our efforts to end homelessness?
Great. Thank you so much for that question. I'll start with the second part of that question around USICH. This is a point that's very close to my heart. I spent 10 years as a career public servant at the Department of Housing and Urban Development, most recently as the Deputy Assistant Secretary for Special Needs, before going to the Corporation for Supportive Housing. And I will tell you from my own experience and from the experience of many of my colleagues across the federal government that the kind of progress that we made between 2010 and when I left in 2017 really was contingent on having USICH in the place where they sat. I mentioned in my testimony that the 47% decrease in homelessness among veterans was not a coincidence, because it wasn't. It was the result of hard work, and it was the result of, and that kind of progress was made in different areas as well. That's the one that most people know. But it was the result of alignment. And when we're talking about alignment, we're talking about funding alignment, policy alignment, making sure that everybody is sort of marching in the same direction, because if you don't have that within the federal government, then you won't have it at the local level as well. USICH was incredibly, incredibly important in all of those efforts, and remains incredibly important to make sure, again, that folks really understand how to move forward together. On the issue of chronic homelessness, I've had the opportunity since I left HUD to do some work in Los Angeles for the city of Los Angeles. And I agree, chronic homelessness, especially unsheltered homelessness within the city of Los Angeles, it's tough to see. We know that supportive housing is the solution for ending chronic homelessness. And back in 2015, I was briefing the U.S. Interagency Council staff and members on the point-in-time count, and we saw for the first time that chronic homelessness, that what progress we had been making was starting to flatten out. And it was really pretty directly tied to the kinds of decreases in federal funding for supportive housing. You could see, like after sequestration, you could see that the decreases in federal funding were really having an impact on chronic homelessness. So we know that supportive housing is the answer for that population. There is a lot of evidence behind that, and we need to invest more funding in supportive housing for that reason. Thank you.
Thank you very much. The chair now recognizes the distinguished ranking member, Mr. McHenry, for 5 minutes for questions.
Well, thank you so much, Chairwoman Waters. Dr. Lucas, thank you for your testimony. And I think though homelessness is down over the last decade, according to our government statistics, we know that it still affects every community in this country. So let's start with the hardest question to answer, which is, what do you see as the root causes of homelessness?
Well, one of the big challenges and the reasons that homelessness is a very complex issue is that there are many different root causes. Housing is a very significant explanation, housing affordability, and the factors that affect that can be local in nature. At the individual level, there are many different causes of homelessness, even if, as I mentioned, if you compare people who are experiencing unsheltered homelessness, who are physically living in cars, parks, or places not meant for human habitation, compared to those in shelter. If you compare individuals who are on their own to families, even men and women, and across race as well, there are many different circumstances that are precursors to homelessness.
So can homelessness be solved?
I think that there is likely not a yes-no answer to that. I do believe that we've learned a lot about things that work better than previous efforts. We have seen evidence that studies that compare housing first approaches for individuals with mental illness or disabling conditions do work better at housing retention. However, there's limited evidence that those are, one, cost-effective, or two, actually reduce the incidence of substance abuse, at least in the studies that we have that actually compare outcomes of what would have happened otherwise. And so, it's more
cost-effective, the question of cost-effectiveness. So it's not just a question of money, it's how you utilize those monies.
Certainly, and while there are some claims that permanent supportive housing solutions save significant costs, actually a 2018 report by the National Academies of Sciences, Engineering, and Medicine revealed that actually there's insufficient evidence to demonstrate that permanent supportive housing saves healthcare costs or is cost-effective relative to existing alternatives. And that's likely because the costs vary considerably from community to community.
So you mentioned innovation is a key part of the solution set for homelessness, but you talk about the one-size-fits-all approach at the federal level, and then and how that should fit into this continuum of care, as well as sort of that federal coordination with state and locals. So to that point, Has the continuum of care program been effective? And what recommendations would you give this committee to transform this federal approach?
One of the really admirable and valuable things that USICH has spearheaded is the increasing the collaboration and the creation of databases. They're called HMIS systems, Homeless Management Information Systems, at the community level. And those allow organizations to share information about client shelter entries, exits, reentry, et cetera, in ways that we didn't know before in a systematic way. With data like that, we now have the opportunity to identify programs and communities that are much more or less effective in the actual outcomes that we'd like to see. And so further investment in that sort of approach allows us more flexibility in the solutions that are being implemented.
So data sharing, is it in essence? Is that, and so you're tracking folks that are perhaps in repeated homelessness cycles, or those that are chronically without shelter?
That's right, which is a much smaller subset of the homeless population. The average shelter stay in 2017 was somewhere on the order of 40 days. So there is a large subset of the homeless population for which homelessness is brief and actually non-recurring.
So how do we leverage federal taxpayer in 30 seconds? How do we leverage this federal taxpayer dollar to get a better outcome?
Well, most of the allocation currently is on the basis of need, and there's also explicit in the bills being discussed prioritization of an earmarking for permanent supportive housing and housing first approach for much of that funding. And rather than requiring that and prioritizing that in the notice of funding availability through HUD and others, allowing results to drive solutions would be better.
Thank you for testimony.
Thank you very much. I now recognize the gentleman from Missouri, the chair of the Subcommittee on Housing, Community Development, and Insurance, for 5 minutes. Congressman Clay.
Thank you, Madam Chair. Let me also thank the witnesses for your testimony today. Let me start with Mr. Stewart. The number of veterans experiencing homelessness in the U.S. has declined by nearly 46% since 2010, with an even greater decline among unsheltered veterans, thanks in large part to increases in funding. For veterans experiencing homelessness, more than 600,000 veterans and their family members have been permanently housed, rapidly rehoused, or prevented from falling into homelessness through HUD's and VA's homelessness programs. Can you speak to this progress, and what have we learned from fighting veteran homelessness that we should apply to ending all homelessness?
Absolutely. Excuse me, absolutely, Congressman, and thank you for that question. And I promise I'm not being flipped when I say everything. Every lesson we've learned as we've worked to end veteran homelessness can almost be directly applied to ending all homelessness in the United States. We've learned about funding evidence-based practices. We've learned about collaboration at the local level being crucial. There was just a question about continuums of care. And I would say that the continuums of care, linking COC programs to VA-funded grant programs in a community is a precursor and a requisite precursor to success in a community. So joining forces, sharing the same goal, discussing tactics, having a coordinated entry system on the community level, these are all very real tactical things that we've learned that need to be replicated across the system to replicate our successes from the veteran space.
And you think that would work with the chronic homelessness too?
Absolutely, sir.
Okay.
We focused very early on specifically targeting our HUD-VASH vouchers to chronically homeless veterans, so it's been proven to work for that population.
Thank you for that response. Ms. Oliva, some communities use zoning, or they pack the homelessness and the shelters into just one area. Can you share with us some of the don'ts or the least successful models that you've seen around this country that we should not try to emulate?
Yeah, well, thank you for that question. You know, I think that communities that are struggling the most, obviously there are external factors that we're all recognizing here. There's affordable housing shortages, there's local land use policy and zoning policies, for example, around density or other things that would really impact the ability to increase the supply of affordable housing and supportive housing in a community. So in communities that I'm working in now, the most success that we are having is when those things are all sort of packaged together. We're talking a lot on this panel about the homeless services system, but I would argue that obviously homelessness cannot be solved by that system alone. So rather than saying what the don'ts are, I think that I can say what the do's are. And what the do's are is you have to look at this as a package of policy, program, data, all of those things together to really understand how things at the local level interact, how services for people who have substance use disorders or who have mental health issues interact with the homeless services system, or how youth access the homeless services system or can access affordable housing. So, and then wrap that together into really robust policy initiatives that help on a variety of fronts, not just on homelessness.
Sure. And Dr. Lucas, can you share with the committee the best practices that address ending homelessness that have reduced numbers in communities around this country?
Well, thank you for that question. As I've mentioned, and as has been mentioned, one of the dramatic effects of the policy efforts over the last decade has been the expansion of permanent supportive housing, much of that adhering to a housing-first approach. The estimates of what we've seen at the aggregate level on that suggest that it takes 10 additional permanent supportive housing beds to reduce homelessness by one person. And if the estimated costs of that are about $20,000, that's about $200,000 per person, for a total of the current homeless population, $110 billion. So we don't know yet.
But thank you for those responses. I yield back.
Thank you very much. I now call on the gentlewoman from Missouri, Ms. Wagner.
Thank you, Madam Chairwoman, for holding this hearing today on the heartbreaking crisis of homelessness, which affects every community in America. Last year, I was honored to visit Loaves and Fishes, the longest operating homeless shelter in St. Louis County. I witnessed firsthand their tremendous work to help those who are experiencing economic hardships. Catholic Charities of St. Louis, St. Patrick's Center, and so many other organizations in the St. Louis area are coming alongside disadvantaged and marginalized populations to help people get back on their feet. I am eager to work with this committee, Madam Chairwoman, this year to advance accessible and affordable housing for those who need it most in the St. Louis region and across the country. I'm proud that Catholic Charities St. Louis has just been selected to participate in a 5-year healthy housing initiative to reduce chronic homelessness and frequent ER visits. This multi-million-dollar initiative is being led in collaboration with the St. Patrick's Center, the Archdiocese of St. Louis, Incarnate Word Foundation, Mercy, BJC Healthcare, and SSM Healthcare. Dr. Lucas, I believe that local collaboration like this between hospitals and shelters can complement the goals of the federal programs. What can policymakers learn from these types of collaborative programs?
Well, thank you for your question. We certainly have learned that being able to collaborate not just in the efforts but in the sharing of data on what is being done, frankly, will take a step toward identifying what works. And so there have been some investments in developing systemic responses where there are many stakeholders at the local level involved. And those are the kind of things that right now only a fraction of resources are being devoted to relative to the $6 billion that are already being spent each year on this issue.
Because so many of these partners are, in fact, on the front lines, and to share the data, to share the information, I think helps all. Fighting sex trafficking and providing services for women and girls who are trying to piece their lives back together is one of my very, very top priorities here in Congress. I'm currently working on legislation to increase the availability of housing to human trafficking victims. Ms. Roman, I know your organizations, or Ms. Darley, one or the other, have been supportive of legislation to provide housing to runaway and homeless youth. Is there space for local housing authorities to partner with anti-trafficking service providers to provide better assistance to victims of trafficking? And can you discuss how we can most effectively provide housing to trafficking victims? Ms. Robin.
Well, just briefly, and thank you for the question. Again, I think housing really is the solution to so many of these problems, and there's absolutely space for housing authorities to be working with organizations that are trying to prevent trafficking. And I think targeting some of the PHA resources more to the most vulnerable people across the board would probably improve a lot of outcomes. It's a tremendously important issue, though, as you point out.
Thank you. Ms. Darley, do you concur?
Sorry, I would have to agree. Women experiencing homelessness, living in a shelter or out in the open, unfortunately, are the most vulnerable individuals, even sometimes more so than children, but children are a part of the trafficking also. So, of course, there's room for that.
Thank you, Ms. Darley. Dr. Lucas, you wrote in your testimony that the federal government has increased its investments in combating homelessness in recent years, but we unfortunately haven't seen the results we may have expected. Can you briefly discuss local policy decisions that are hindering progress and contributing to the homelessness crisis throughout the country?
Well, thank you for that question. As I mentioned briefly, there is a fair amount of rigorous evidence that land use regulations that make it more difficult to expand the supply of housing have a very significant effect and are high predictors, very strong predictors of rates of homelessness, for one.
All right, thank you. Do you believe that there is a one-size-fits-all federal approach that is outdated and needs to be replaced, sir?
Well, in many ways, certain inputs, the types of programs we do, have been prioritized rather than the outputs that they're yielding. So in that sense, yes.
Thank you. I appreciate it. I yield back.
I now yield to the gentle lady from New York, Ms. Maloney, for 5 minutes.
Thank you, Chairwoman Waters, for holding this really important hearing, and Ranking Member. I would like to ask Anne-Marie Oliva a question. In New York City, which I have the privilege of representing, we have one of the highest homeless populations in the nation, but most of our homeless population lives in sheltered areas. They have shelter. Only 5% is unsheltered. Could you give us specific policies that would particularly work in helping the homeless that are in sheltered facilities?
Great, thank you for that question. I do have quite a bit of experience looking at New York, looking at their data and their policies over the last, 20 years of work that I've been doing in this area. And New York City has a high sheltered population because they have a very unique local policy or local laws around a right to shelter. There are only a handful of communities across the country that have a right to shelter, and New York City is one of them. So that's one of the reasons that there is a very high sheltered population in New York City. But I think that the answers in New York City are similar to the answers in other places, and that is really the right mix, understanding your data, understanding the intersections between populations that are using other systems, the mental health system, the substance use system, the youth system, and the jails, and really understanding those intersections and developing the kinds of interventions that will work for people in those intersections. Sometimes it's supportive housing, sometimes it's something else, and allowing for innovation in those areas. I think New York in particular has a really big opportunity and has a history of working in those intersections to understand the needs of people who are using all of those different systems.
Thank you. I would like to ask all of the panelists, and I thank you for your testimony. I would like to ask all of you the same question, starting with Carolyn Darley, and just go down the line. And answer yes or no and or pass. I want to know, do you think that Congress should prioritize addressing the homeless crisis by passing the Ending Homelessness Act, which would provide $13 billion to combat homelessness in various programs? And this would be paid for by shifting $13 billion that's been allocated for an aircraft carrier or some other similar weapon. Just yes or no or pass. Ms. Darley?
Yes.
Yeah?
Pass.
Yes.
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 Yes, with the caveat that I don't care how we pay for it.
I was making a point on literature and information that was in our research that showed that some of these weapons cost as much as is projected that would end homelessness in our country. I would like to ask Ms. Oliva again, we see in the research that there are many populations that are more affected than others. We heard testimony that there's been progress made with veterans. Could you comment on what populations are the most in need and any ideas of how we could be more helpful to those populations?
Thank you for that question. So certainly, we need to be able to walk and chew gum at the same time and address the populations that are really high need across all. So families and individuals, people experiencing chronic homelessness, veterans and youth. I would say right now we're making incredible progress on trying to understand and be able to develop innovation around ending youth homelessness. You heard from my colleague, Mr. Rush, today about some of the work that True Colors Fund is doing, as well as some of the work that the federal government is doing on ending youth homelessness for a very vulnerable population of young people who have started to experience homelessness as children and are now sort of in transition age. I would also say that, again, people who are experiencing chronic homelessness and who are living out on the streets are particularly vulnerable because they have been outside for so long and they have a lot of disabling conditions. So our focus on young people, our focus on people who are experiencing chronic homelessness, as well as on families, we have to be able to do all of those things at the same time.
Thank you. Thank you very much. I now yield to the gentleman from Missouri, Mr. Lukemeyer, for 5 minutes.
Thank you, Madam Chair. And interesting panel this morning. Thank you for that. Mr. Stewart, it would seem to me that from the information that we've been given and the statistics that have been shown that it seemed like we were making a dent in the veterans' homelessness. Would that be a fair statement?
Yes, absolutely, Congressman.
And by doing that, the approach that has been done in your area, it would seem to me that that would be an approach that across the board we need to be taking. Would that not be a way to start the thought process?
I think that's also a very fair way to think of it.
And why are we not doing that? And the rest of the homeless groups.
I think to a certain extent we are, Congressman,
Okay.
respectfully. The learning that we've done in the veteran space, the development of best practices, is directly relatable, and it is oftentimes used, is transferred to other sectors of the homelessness population at the community level, all the way up to USICH, disseminating those practices.
I saw one of the slides that we had up a minute ago that with regards to veterans, and I think it was between 2007 and 2017, there were 31,000 people who became homeless, and 30% of those were veterans, which is a staggering number. Is that number correct? Do you concur with that?
I didn't see the slide, Congressman. I do know that there's 37,878 veterans that are experiencing homelessness on a given night this year.
Okay, so there's more veterans that are falling into this situation, but yet we're able to get a handle on that, more or less? Is that what you're saying?
That's always the challenge, Congressman,
Okay.
is every year more people present for care. More people fall into homelessness. That's true for every population, and I used to say that if I could wave a magic wand and solve veteran homelessness, I would, but then tomorrow morning there'd be new people to serve.
Mr. Lucas, you talked a little bit about some of the statistics on this, but I serve so the rural parts of Missouri as well as the suburbs, exurbs of St. Louis, but I've got lots and lots of rural area. Can you give me some numbers or describe the situation for rural homelessness? Is that a problem? Are the causes, the situations the same, different? Would you have a different approach to those folks than you do for urban individuals? Can you elaborate on that just a little bit?
Well, thank you for that question. Off the top of my head, I don't have the relative share of homeless who are rural as opposed to urban, but there is a sizable subset of the homeless population living in rural areas, and it's an important subset of that population. And in some ways, one of the biggest things that's very different across those two are the alternative systems that are available and the costs of use of, for example, other systems in urban areas as opposed to rural areas. And so certainly the cost effectiveness of different solutions and the effectiveness in terms of facilitating housing retention are
in rural areas, we did have on this panel a gentleman from New Mexico who over 50% of his citizens in his district lived in mobile homes. Lived in very, very rural areas of New Mexico. And so housing in rural areas is significantly different than that of urban areas. And so it would be, I would think you'd have to have a little bit different approach in that respect, but the situation is different. Let me move on. Also, I think Mr. Lucas, in breaking down the statistics of homelessness, I know Ms. Darley made the comment a while ago with regards to some of the folks that she experienced in some of the shelters who were employed, apparently good jobs, and yet still wound up in shelters. Can you tell me the impact, I guess the percentage of people who are homeless who have jobs and who maybe don't have a job right now, but if you gave them a skill set, could go get a job? Because it would seem to me, if we're looking at being able to afford to be able to pay rent or to afford to be able to buy a house, you're going to have a job. Or if you're disabled, you have to have a check of some kind probably, or subsidy of some sort. But for those people who are capable of getting a job and the skill sets, what percentage of those people would make up the homeless people today?
Well, we know that there is some evidence that percentage is increasing in terms of the people entering shelters, that there are higher rates of people entering.
So I've only got 15 seconds left. I mean, one quick question. If those folks, I realize there's a lot of different things that can hit somebody in that situation, but would a financial management course or class or somebody in a social services setting be able to help them?
Possibly. We don't know yet.
Okay.
We need
Thank
to
you.
Thank you. I now yield to the gentleman from Georgia. He is recognized for 5 minutes. Mr. Scott.
Thank you, Chair Lady Waters. You know, we are running through a number of very important statistics, but the absolute most glaring statistic is this, that we really got to put on the table, and that is 40% of all the homeless men, women, and children are African Americans, and they only make up 13% of the population. Now, we can dance around a lot of things, but if we're serious about doing something for the homeless and dealing with this, we got to pull the covers off of this ugly thing called racism. And so I want to ask Ms. Romaine, I think you came closest to touching on this, if there are other members that would like to. And here's why. Many of us on this committee are working with Ms. Waters on a bill that will bring $13.27 billion to this issue. However, if we don't get under these covers and pull off the scab of this racism that is causing 40%. Just imagine if 40% of all the people in this country were homeless. That's what I'm talking about. So, Ms. Romaine, could you tell us, because you touched upon it, your thoughts on this? What must we in Congress do to deal with the racism that is here? Because it is shameful that 40% of all the homeless men, women, and children are African American. Thank you. Would you?
Of course, I wish, and I'm sure you wish, that I had a simple answer to that question. But if I could just reflect on two parts of it. One is, how does it come to be that 40% of people who are homeless are African American in the first place? The homeless system really has very little to do with that. That's the feeder systems into homelessness. So all of the things that you all are addressing, the disproportionality in the criminal justice system, the disproportionality in the child welfare system, these are two of the biggest feeder systems into homelessness. Housing discrimination, it goes on and on. So those things have to be addressed. They're not going to, the homeless system can help to address those, but we don't control those things.
Okay.
What we control is what's essentially a crisis system. But we have to look at the homeless system to see, are we entering people into the homeless system at the same rate regardless of race?
Okay, ma'am, I only have 1:20. I definitely want to get to Mr. Stewart because I think there is a direct application to this. Mr. Stewart, you talked in your about two things: coordination and funding, working together. And that has been what has succeeded with the Veterans Program. It's the fact you're able to coordinate with the federal agencies and apply the money. Can we do this with respect to being able to deal with this huge disparity among African Americans and homeless?
I believe so, Congressman. I believe a lot of the groundwork has already been laid. A lot of the local level collaboration that we're talking about that was done in an effort to end veteran homelessness serves multiple purposes.
How would we be able to apply this big bill that we're working on? Because I think we can put some muscle behind what Ms. Waters is leading the effort on and applying some of this money to addressing the racism factor. I mean, we're going to get $13.27 billion to work in this.
I think we have to, Congressman. If we're really going to solve the issue of homelessness, we have to.
Thank you very much. Let me just take this moment to say that despite the fact that you saw the USS Gerald R. Ford aircraft depicted on the screen, I don't want anyone to go out saying that's where we're going to get the money from, that we've targeted that particular aircraft. We have not targeted any existing funds. We're looking for the government to fund this program without having to target existing programs. Thank you very much. With that, I will call on the gentleman from Michigan, Mr. Heisinger, for 5 minutes.
Thank you, Madam Chair. And representing part of Gerald Ford's old congressional district, I do appreciate that. And since it is out floating already, I'm not sure we could put it up for sale anyway. But Mr. Lucas, I'm not a big fan of the yes/no question that was thrown at you earlier. You passed when you were asked about the $13 billion package that has been proposed, and I just wanted to give you 30 seconds to elaborate on that.
Well, thank you. My take is that additional spending in the ways proposed is unlikely to achieve the stated goals of the legislation based on the evidence that we've seen at the population level. Despite seeing some increases or decreases in homelessness, the effect of these policy changes on that have been fairly limited to date based on the evidence that we have.
So it's basically effectiveness right? I mean, you're questioning how do we effectively use and succinctly use the monies that are put into the programs?
Yes.
Yeah, okay. I also want to explore a little bit about the, excuse me, the influence of local zoning and the regulatory structure. Recently, there was a joint study by National Multifamily Housing Council and National Association of Home Builders, and to be clear, my family is involved in construction and building. And I've seen this firsthand as well, but that study said that approximately 30% of costs associated with building multifamily developments was attributed to local zoning and regulatory requirements. And Ms. Oliva, you had said that earlier. It's not just, I think this is your quote, not just homeless services system, but we need a package of all these local services. And I just wanted to give you an opportunity, if you looked at that, you mentioned the zoning and what some of those structural barriers might be to having affordable housing being built.
Well, the first thing I would say is that there has been a decreased federal investment in affordable housing over the last several years. If you look at the Section 202 program or the home program, other types of programs that the federal government has historically used to help spur local investment. And that has been a fairly significant decrease over the last several years.
How about the influence of local and state regulations?
So I think from the local and state perspective, what we're seeing is localities trying to find creative ways to innovate and to merge types of funding, like from Medicaid or the health.
So do you believe that there are more barriers or fewer barriers that are being put up by local? I'm talking specifically zoning. I'm not talking about taking different pools of money to address this.
So I don't think that that's consistent across the entire country. There are communities that are taking a lot of very positive steps towards making zoning changes so that affordable housing can be developed.
My experience has been the opposite, frankly, that there have been more barriers put in. Mr. Lucas, Dr. Lucas, do you have anything that you'd like to add on that?
No, not at this time.
Okay. Real quickly, and Ms. Roman, I'd like you to address, this has been an issue that has come to this committee's attention and previously, and we have touched on this, but there is a segment of homelessness that I'm concerned about, is seeing kids, foster kids, that are terming out. And they're not necessarily eligible. We know that there is this event horizon that is happening when they come of age, yet they may not be able to access some of those systems. And I'm curious if you could comment on that quickly.
Well, I think if they're homeless, they can access those systems. There's nothing that's stopping anybody who's exiting foster care from receiving assistance from the homeless systems. We would hope for better outcomes from the foster care system than to emancipate young people into homelessness. Mr. Rush may also, who works on that issue much more, have thoughts about that.
Well, I've got 30 seconds, so I want to also ask, what coordination should happen? There was a little discussion about trying to look at the totality of who folks are. And my colleague brought up financial planning, but we also maybe have substance abuse. We also have mental health services that may be getting to access. It seems to me we probably might have some HIPAA issues as you're having some coordination. And, I'm looking at what types of roadblocks that we might have structurally that could help that. And my time is out, but maybe we can communicate by letter afterwards, and I appreciate your time.
Thank you very much. The gentleman from Missouri, Mr. Cleaver, is recognized for 5 minutes.
Thank you, Madam Chair. I want to follow up on what Mr. Scott began to talk about, and to some degree, Mr. Huizinga just mentioned it, and Ms. Darley, Ms. Oliva, and Ms. Romans. And by the way, thank you for your willingness to come back over these years that I've been here. Thank you. And that is the homelessness. There are other issues that probably can eliminate homelessness that is somewhat troublesome. And to be completely contemporary, I read this article about a guy from Rio Dale, California, Michael Rollimer, I think is his name, who was a federal employee who was quoted in a Los Angeles newspaper saying, I'm about a week away from homelessness. This is a guy who gets up and goes to work every day for the United States federal government. And because of the shutdown, he's moving toward homelessness. And Zillow, which is one of those online realtors, they estimated that 40,000 mortgages were at stake during the government shutdown. 40,000. And so I think it makes us feel a lot more comfortable to just think this is some guy who just doesn't want a house and he doesn't want to work and so forth, as Ms. Darley mentioned, that those are the homeless folk. And so can you guys talk about the issue of housing instability, which I think is one of the primary factors in creating homelessness? Ms. Darley, you mentioned that whole issue, people having to live with relatives, sleeping on the sofa. Well, I don't want to go in it. I'd like for you and Ms. Oliva and Ms. Romans to talk about the housing instability that precipitates, in many cases, homelessness.
Thank you for that question. Housing instability starts with the very first thing that I mentioned, which is lack of affordable housing. I was surprised to find that so many individuals worked or had some sort of income, i.e. Social Security, when they were in shelters, and I asked why, because they could not afford rent. They had money, but not enough for rent. Also, with gentrification happening in so many of our large cities, there's a saying that if you see the red bicycles, then you know that your neighborhood is going to change. And these neighborhoods who were at one time undesirable all of a sudden become hip, and people that have generationally lived there have to move and find housing elsewhere if they find housing. So that is something that I found. I don't know if I've answered your question, but
yes, that is gentrification.
Yes,
clearly,
which was not mentioned.
I was in San Francisco earlier last year, and I was with some friends driving around, and we saw a Latino guy walking down the street, and I said, this is the first time I've seen a Latino. And my host said, well, it's going to be very difficult for you to see them after 5 or 6 o'clock, because the population for African Americans in San Francisco is below 3%, and Latinos is lower than that because they can't afford to live there, so they cross the bay. Ms. Romans?
Well, just to say what you know, which is that poor people generally are paying way too much of their income for rent because there's not enough affordable housing. So the majority of people who earn below 30% of area median income are spending more than half that income for rent, and that causes housing instability and puts them at risk of homelessness. Mm-hmm. And that's because of the gap, the 7 million unit gap in the number of affordable and available units. And that's what you're seeing in San Francisco. There are no affordable and available units there.
Ms. Oliva?
Yeah, paying 30% of your income towards rent, that is not, that number actually plays out in the report that was done by Zillow recently that you just mentioned. And I said in my testimony as well, that when people spend more than 32% of their income in rent, then the community sees a more rapid increase in homelessness. So there's a very direct correlation, as you're saying, between housing instability and homelessness.
Thank you.
Thank you very much. The gentleman from Kentucky, Mr. Barr, is recognized for 5 minutes.
Thank you, Madam Chairwoman. Thank you for hosting this hearing, and thank you to our witnesses for your testimony. We all join you in your desire to combat the problem of homelessness in America. And when it comes to federal efforts to combat homelessness, Congress and the executive branch have had a tendency, I believe, to implement a one-size-fits-all policy because the causes of homelessness are complex and varied. And while often carried out with good intentions, this one-size-fits-all approach has failed to produce the intended results that we're all seeking, which is, of course, less homelessness. After working with groups in my district in central and eastern Kentucky who are working and doing great work to combat homelessness and really caring for these people who are struggling and suffering, I have seen the impact that the Department of Housing and Urban Development's over-reliance on the Housing First model has had in terms of diminishing the opportunity of creative solutions outside of the Housing First model. These organizations must choose to either change their approach and adopt a Housing First model, or they lose their HUD funding. And while I understand that Housing First may benefit certain portions of the homelessness population, I am concerned about the lack of flexibility for federal funds. Mr. Lucas, my question is first for you. Through federal bias in funding decisions, Housing First has largely displaced other approaches, such as those including transitional housing. Is there sufficient evidence to abandon programs like transitional housing? Is there sufficient evidence out there to abandon approaches that don't include wraparound services targeting the root causes of homelessness, such as addiction and lack of work, lack of skills, lack of education? Shouldn't we be looking at programs that target the root causes of homelessness as opposed to just saying homelessness is the result of a lack of shelter?
Well, thank you for your question. In some ways, the short answer is it depends. But as you mentioned, transitional housing is a type of shelter that we've seen massive reductions in the total supply of over the last 10 years. It's cut in half to about 100,000 beds of that type now. And in part, that is because organizations that are providing shelter services have now faced strong pressure to adopt certain types, specifically Housing First type models, to increase the likelihood that they can retain retain funding, excuse me. And for that reason, there is some evidence that transitional housing is incredibly costly, but there's only been a small number of studies that actually compared those costs. And it may be that certain transitional housing programs are more effective than others. There may be other types that we haven't even thought of yet. There are prevention programs that cut off homelessness in the first place before it has occurred that have been very successful in New York City, the Home Base program, and then in Chicago as well.
Let me jump in and ask another question about Section 8. The Congressional Research Service has looked at the Section 8 Housing Choice Voucher Program. They've looked at public housing, and what we can identify from the data is that about half of the recipients of public housing or housing subsidies, Section 8 subsidies, they're disabled or they're elderly, not capable of working. And then another half of the recipients of public housing are able-bodied, work-capable adults. And if you look at the data further, you see that about 20%, maybe a little bit more than 20%, of those are prime-age, work-capable, able-bodied adults with no wage income. We have more job openings in America today than there are unemployed Americans. People who are struggling in homelessness or who don't have housing, they are talented people who could contribute their talents in the workforce. What are we doing in terms of combating homelessness with our HUD programs to require of able-bodied, work-capable adults work as a condition of receiving housing benefits? And wouldn't that be the practical route to escape poverty for those 20% of the population that receive housing benefits, to require work as a condition of receiving those Section 8 benefits? Any of you, but Dr. Lucas, go ahead.
I'll be quick just in case anyone else wants to say anything. The Housing First approach specifically does not require anything like that, and there are certain people that face significant barriers to obtaining employment for which that might not be the solution, but there are many others where that might be an answer.
Well, my time is expiring, but I would just say that before we spend $13 billion, we should look at more creative solutions like that, and I yield back.
The gentleman from Florida, Mr. Lawson, is recognized for 5 minutes.
Thank you and welcome to the committee. To you, Mr. Darley, I want to ask you a question. When I was a boy growing up in the country, lightning struck, house was burned to the ground, and I can recall moving with the family 5 times. Was I homeless or was I in transition?
Thank you for asking. As far as I know, the definition for homelessness is if you are not on the lease. So maybe you were. You have to consider individuals that couch surf and stay with friends and family. They are still homeless because they don't have a shelter of their own. So maybe you were, but maybe you were also in a community that was able to assist you and help you out, whereas this happens mostly in cities, and the individuals in cities, I'm sorry, are not as either willing or able to help out others in the same way.
Okay, my other question could be to the whole panel. With the decrease in HUD funding over the past several years, how has the federal government the ability for you all to implement housing program that provides safe and affordable housing options for people? Anyone on the panel can answer that.
I can start. While there's been some small increases for homeless assistance, the federal housing budget is obviously insufficient to meet the need, and 3 out of 4 people who are eligible for assistance are not getting it.
Anyone else care to respond?
And in the homeless programs in particular, the focus really has been on trying to ensure that the funding that is made available from year to year is used as effectively as possible. So I think that that's something that is incredibly important for folks to recognize for the homeless programs in particular, that using the money that they have as effectively as possible is a priority.
And just to add to that, I would say that the lack of resources and funding has led to, I would say, a lack of innovation, specifically in focusing on particular populations that are disproportionately impacted by experiences of homelessness. And an investment moving forward would allow for some of that innovation to be able to specifically, in thinking about something like the Youth Homelessness Demonstration Project, to be able to focus and target strategies towards preventing and ending youth homelessness where they can be applied and most necessary.
Okay, and Dr. Lucas, quickly, how do you describe the differences between rural homelessness and inner city?
So in cities, there's typically much more, the shelter systems are definitely more interconnected historically, and the density of the population certainly has a factor in the nature of homelessness in those places. There are also other opportunities in terms of employment and the rules for expanding housing supply that are maybe much more stringent historically in urban places where the costs of expanding the housing supply, especially for more affordable housing, can be prohibitive in some ways.
Okay, and this is another quick question, anyone can respond. I've run into a lot of people who really don't have to be in a homeless type situation, but they want to be in it. How did you distinguish between those groups?
I'm going to try to answer that. If you could clarify, are you saying that people are homeless, but they don't have to be?
Yes.
I'm going to have to beg to differ as far as that's concerned. People do not want to be homeless. As a former RN working in an emergency room at George Washington University Hospital, I had the opportunity to see individuals come in that were homeless and ill and feigning an excuse in the emergency room for somewhere to stay. And the answer to that clearly is no.
Okay, well, I have seen people have family resources where they didn't have to be in there, but they'll say they're homeless because they did not want to be in the situation they were in. So
I've seen that also.
Okay.
But I would say that that would have to do more with a mental illness, or where a lack in judgment is, they're not thinking clearly, because who would turn down a place to stay? But I've seen it many, many times.
Okay. I yield back.
Thank you. I now yield to the gentleman from Colorado, Mr. Tipton, for 5 minutes.
Thank you, Madam Chair. Last year, a report from the Department of Housing and Urban Development reported that Colorado as one of the states with the highest levels of homelessness in America. The findings did highlight that homelessness slightly decreased in the last year, but the Colorado's rural areas are experiencing nationally significant levels of homelessness. Dr. Lucas, I'd like you to be able to speak to a couple of issues here. I represent many of the small towns in rural Colorado where affordable housing advocates have suggested the policies that might be relatively simple to implement in larger cities like Denver may not be practical or even accessible for smaller towns with limited resources. At the small town level, could the lack of resources to be able to parse through the applications, proposals for the federal and state resources be a contributing factor to the nationally significant levels of homelessness in the rural areas?
Well, thank you for that question. If I may restate, is it because, are you asking if it's because of the difficulty of applying for those funds that's a barrier? I actually don't know that I can speak maybe even the best on this panel relative to others who are actively involved in that grant application process. It's certainly, my understanding is that there are collaborative efforts to try to help make this application process a little bit easier so that there's a joint application at the COC community level for most of the targeted homelessness assistance.
Yeah, it's interesting, you know, going through our district, we have homeless in very rural areas, but one of those big challenges is simply applying for the grants, the applications. You simply don't have the resources, the people to be able to fill them out and address really what is a real common concern. Dr. Lucas, in your testimony, you did advocate for increasing organizations' flexibility to use existing scarce resources toward innovative efforts to alleviate homelessness in the communities. Could you maybe expand a little bit on some of those innovative solutions that you would see to be able to address the homelessness?
Yes, well, thank you. So there are two example programs that I might mention that are sort of in some ways inconsistent with a housing first prioritized approach, and in that sense haven't received funding in that way. One is the Doe Fund in New York City. This is a program that has employment as an integral part of the rehabilitation process for people who either are leaving incarceration or who have been homeless or who are otherwise struggling. The other is near Austin, Texas, Community First, which is a program that involves basically tiny houses, if you've heard of some of these very small units, in a more community setting, actually requires the clients who are trying to create housing stability and achieve that to interact with one another in more substantive ways where community engagement is a more effective sort of rehabilitation tool that, again, is not required and not essential in the existing housing first approach where that's the only requirement.
And I appreciate that. I had the opportunity to be able to go through the Doe project, and I think it speaks to my colleague Mr. Barr's point in terms of trying to actually address the root problem, being able to get the employment so that people can actually afford the housing. But when we start talking about the affordable end of housing, come from a unique state with some of the richest communities in the country in my district and some of the poorest communities in the country that are in my district. Under the chairwoman's proposal to be able to limit the tenant rent contribution for the Housing Trust Fund to 30% of the adjusted income, we've heard some concerns about that. Ms. Roman, would this proposal challenge the flexibility of local areas to be able to respond to the specific needs of the community and potentially challenge the ability of communities to be able to lock in financing for affordable housing projects?
Well, I don't know about the financing side. Obviously, there has to be revenue coming in, but I think the 30% standard of affordability is pretty important to keep families and individuals from becoming homeless once they're in housing. If they're spending much more on housing, it's very difficult to pay for other things like food, healthcare, transportation, and so forth. I've just to add quickly, too, that the homeless programs really, except for permanent supportive housing, don't subsidize people for a long time. They are employment programs. People have to work to pay the rent. They're not getting long-term rent subsidy from homeless programs. So they're work programs. People have to get to work to pay their rent.
Great. Thank you. I yield back, Chairman.
Thank you very much. The gentleman from Guam, Mr. San Nicolas, is recognized for 5 minutes.
Thank you, Madam Chair. I come from a very unique district that has a much smaller population than a lot of my colleagues. One of the things that we find is program ineligibility actually is a huge factor in the homeless situation that we're dealing with in my district. Does anybody have any input on how much of the homelessness we're dealing with in this country is as a result of actual program ineligibility, and what are some recommendations for turning those figures around?
Hi, thank you. I actually lived in Inarahan, Guam for a period of time in my life, so I have a little bit of insight into how the system works there. And when you say program ineligibility, are you talking about the homeless programs, or are you talking about housing, access to affordable housing?
Just in general, like for example, I would encounter homeless individuals in my district, and I'll say, you know, hey, you have a couple kids here, you qualify for these programs. They say, oh, I'm sorry, we're no longer eligible for those programs.
Yeah.
And so, and we're finding that oftentimes when it comes to the child homelessness, that's the case, where they would have qualified for the program, but unfortunately, due to circumstances that happened previously, they're no longer eligible, and that creates the homeless circumstances that they're in.
So I think that there's a variety of things. The local continuum of care can partner with the housing providers in Guam to identify, again, those families or individuals that are sort of crossing systems to try and figure out what the right intervention for them and where they're eligible. I also remember, and it might still be true, that there really weren't enough resources to go around across the island. So people who might have been eligible weren't actually able to access some of those resources as well, just because there wasn't enough funding. The other thing that I might suggest is to request some technical assistance for the island to make sure that everybody understands the current rules and protocols around eligibility, because I think what I've seen across the country is that sometimes folks are saying that people are not eligible, and Nan mentioned this, when they in fact are eligible.
Does anybody else have anything they want to contribute to the ineligibility component of the homeless figures? Ms. Darley?
I wanted to say something from a personal experience with a friend of mine that was also waiting for housing, and this young lady found that, and I found the same thing, that most of the services were geared toward people that were suffering with addictions, and everyone who's homeless is not an addict, though there is a tendency to go that way once the pressure of homelessness comes down upon an individual. But I've seen individuals lie or say that they will take a drug in order to qualify for a program that would help them because they weren't addicted to, any drug. So I thought that was really unfair, and that more programs need to look at families and individuals that don't have that problem along with those that do. Thank you.
Okay, thank you. Another question I had was, Dr. Lucas, you mentioned in your remarks creativity as an option for getting more solutions on the table, and Mr. Rush, you also mentioned innovation. I want to kind of open it up to the panel. Does anybody have any specific regulation or specific rule or specific limitation that could be addressed legislatively that would actually unlock this creativity or this innovation that we want to be able to encourage with our service providers? Well, I mean, I'm sure everybody gets together and sits at the table and says, man, if only I could get to do this, then I'd be able to solve that. What's holding back some of this creativity and innovation?
Well, I think that to an earlier point and to a question of what we can do to address the disparities that exist as it pertains to homelessness, I and my organization are very much so advocates of there needs to be additional training for service providers. And this is a notion that you see across public health, this idea that when someone is coming in to receive service provision, that we need to make sure that if they are most impacted, that the service provider is able to provide culturally responsive and linguistically appropriate care. And that pertains to LGBTQ individuals, that pertains to people of color. So I think that if we could enact anything from a legislative standpoint, it would be some type of requirement that service providers receive additional training around cultural competency and linguistically appropriate care. Also, when thinking about, I'm not sure if there's a legislative approach to this, but the Equal Access and Gender Identity Rule was, I think I'm running out of time, was implemented in 2016, but I think the actual enforcement of that will get to some of the issues around violence as it pertains to transgender individuals.
The gentleman from Texas, Mr. Williams, is recognized for 5 minutes.
Thank you, Madam Chairman, and thank you to the committee for being here. In full disclosure, I'm a small business owner in Texas. I'm a capitalist, and Fort Hood, the largest military base in America, is in my district. Now, a question I have, has anyone here on the committee hired a homeless person before? I have. In my 45 years of Main Street experience, I have found that homeless individuals have always had a positive return on investment. And the people who accepted my job offers didn't want government help. They didn't want government guarantees. They simply wanted an opportunity and a paycheck. Dr. Lucas, what is the most effective way to provide employment and housing resources to individuals in order to get them back on their feet and providing for themselves?
Well, thank you for that question. Certainly, as you mentioned, there are many individuals who are really able to make a positive contribution from an employment perspective, absolutely. And that's something that is that creates value both for communities and also for those individuals, of course, and to facilitate housing stability. And so the easier it is for organizations and small businesses, for example, to hire individuals, potentially, for example, for a wage where that is a profitable thing to do, that aligns the incentives of those in need and those looking to hire as well.
Things like tax cuts, things like training programs and skill training all help, don't they?
It's possible.
Okay.
I haven't seen the evidence on this.
When it comes down to it, the best way to solve homelessness is to give people a job. We've talked about that, and the skills to succeed. We need our federal housing policy to work together with our booming economy to unlock human potential. If we continue to build a strong Main Street America, support small businesses, and build wealth through taking risks and reaping rewards, it will help immensely, I believe, in solving this problem. The Department of Labor released a report this week that said there were 7.3 million job openings in December. So again, Doctor, what are the major hurdles in connecting the homeless population with someone of the 7.3 million job openings in this booming economy that we have?
Well, one of the challenges for labor markets, just like housing markets, is the physical location of those relative to the people in need. It's certainly true that for the homeless population, this is a very localized situation. For example, California has 47% of the unsheltered homeless population in that state alone, and in warmer states, there are about 2/3 in the 10 warmest states of the unsheltered population. And so allowing the market system to be flexible in responding to where those needs are greatest and where the opportunities are greatest to provide affordable housing, to provide employment, that seems like something that is not as directly a policy outcome in some ways as a functioning society.
Okay, well, another question. In your testimony, you state that the Housing First Plan is often cited as the way to solve homelessness. It sounds as if the federal government is trying to centralize this function at the top of the federal government and stifle innovation. Now, from my experience, 45 years of being in business, the government's one-size-fits-all solutions rarely work for complicated problems. So quickly, can you give us an example of an alternative solution that you believe should be explored in greater detail?
Well, thank you for that question. And as was mentioned, there are a range of programs that are funded through this targeted homelessness assistance. So it is not only the Housing First programs that have been funded. However, as was also mentioned, there is increasingly prioritized funding for organizations that are adhering to the Housing First approach, that are delivering long-term permanent supportive housing programs. And so the opportunity that comes with the availability of data at the community level on housing retention and whether programs are working is to actually reward that performance rather than reward compliance with the types of shelter that have been shown to work in certain particular areas.
Okay, one final question. There are legitimate reasons for people to need housing assistance, and there are people with physical and mental health problems, we all know. people in between jobs and fell on hard times, and many other reasons. With that being said, Ms. Oliva, is there a point where we should determine that people simply want benefits without having to work?
So there's obviously, as you mentioned, a wide range of people who are experiencing homelessness in any given year. And the implementation of strategies like coordinated entry help communities to determine who can go into what programs or who should go into what programs based on their needs. And the most expensive types of interventions are really for the folks who are most vulnerable.
Thank you. I yield back.
The gentlewoman from Michigan, Ms. Tlaib, is recognized for 5 minutes.
Thank you, Chairwoman Waters. It's interesting. So my son is home from school. If you probably hear about the weather and snow days, and sometimes I send them a link and say, I'm in committee, and he read one of the, you'll appreciate this, Chairwoman, he read one of the slides, 13 billion. Why haven't we done it yet? And I just think, sometimes even our 13-year-old kind of gets it and is coming from, the purest of hearts and understanding the critical importance of it. But, one of the things coming from a nonprofit sector, I worked over 10 years from wraparound services around affordable housing, what low-income housing means with, definitions sometimes even on the state level can differ. But it was very clear from those that worked for decades on this issue that jobs won't solve homelessness, housing does. And looking at my district, which is the third poorest congressional district in the country, we have seen such a hike and rise of housing costs. A lot of us, you'll hear many of my colleagues use the word, middle class. For us, it's working families, working class. I mean, these are individuals that many of us have contact with almost every single day, not realizing the person that is at the coffee shop, the person that is at maybe the parking garage, the person, those are the individuals that really are at jeopardy of being in the cycle of poverty and leading to homelessness. When President Trump signed what I call the Millionaire Welfare Bill, he weakened the low-income tax credits, which has been the primary tool in promoting affordable housing. Do you all agree? Yeah, okay, everybody's nodding yes. So one of the experts estimate that the Millionaire Welfare Plan is leading to a reduction of new affordable housing by 235,000 homes over the next decade. They said just the pause button of 2 years did that. Of saying and reducing, again, the attractiveness of low-income housing. And they say that 11 million of residents, and this is where I think a lot of my residents come in, is most of our fellow Americans are rent burdened right now because they're spending more than half, 11 million of them are spending half of their income on housing for rent. And currently, even with the shortage of I think it's $7.4 million of affordable homes, 7.4 million affordable homes is needed right now. Again, there hasn't been this attractiveness to that because of this Millionaire Welfare Plan. It really has shocked kind of the market and the attractiveness. Can any of you speak about that and talk about what that has done in the last 2 years?
Well, I think, it's complicated what the tax bill did to housing, but I will say that, that homeowners are very much advantaged in our tax system in terms of the amount and the percentage of them that get assistance through the tax code versus the amount that we spend for renters. And we really are not, even if you have the low-income housing tax credit, you still have to provide rental assistance for the people that we're all here talking about, who are at 30% of area median income and below. So anything that affects supply or the cost of capital in addressing the supply of affordable housing is going to result in more people being at risk of homelessness.
It was actually President Ronald Reagan that passed, did you all know that? The low-income tax housing. It is incredible to read that he birthed this approach, this what I would call win-win in many ways. And again, it supports what you all are trying to do in the front lines of making it attractive to developers, of course, but also creating really safe environments for affordable housing to exist. and even to some of my colleagues, you know, having one of the most beautiful, blackest city in the country, in the city of Detroit, where 70% of my residents currently are paying over 30% of their income towards rent. There truly is increasing, becoming a crisis that is leading to a crisis in education, a crisis in so many other areas, because we haven't been able to deal with this homelessness problem in our nation. So I just really want to thank all of you for being here. I know time is very limited. My brother helps veterans through the Earn and Learn program. Homeless vets come through and they go through the affordable housing, the Paquette housing in Detroit. It's amazing. And he'll go through this program. And then my sister, and my colleague would appreciate this, helps victims of sexual assault. I'm the eldest of 14, so you kind of get a lot with my family. But one of the experiences they said is housing, Rashida, housing, all the time. They're constantly advocating for me to
The gentlelady's time has expired.
Thank you so much.
The gentleman from
You were not keeping over.
Ohio, Mr. Davidson, is now recognized for 5 minutes.
Thank you, Madam Chairwoman. Thank you to our witnesses. I appreciate your expertise and your passion for helping us deal with this critical issue for our country and for those affected by homelessness. Ms. Roman, in your opening remarks, you mentioned you know, some of the racism that has been a part of that, and I'm just curious if you look at federal housing policies going back to the New Deal, certainly in the era of segregation, to what extent have they contributed to homelessness?
Oh, definitely, they've contributed to homelessness, and that's why the housing discrimination and why the Fair Housing Act is so important today. African Americans are still, there's plenty of evidence being discriminated against in housing.
Thank you for that, and I appreciate the reference. Do you feel like all the work to reform those programs that needs to be done has been done?
No, I don't feel that all of that has been done.
Do you feel that Congress is likely to solve that in a collaborative way in the near future?
I have my fingers crossed.
Well, I do as well. I've been a little discouraged about our problem solving, and so I'm working on a bill called the People Care Act, and it proposes a bipartisan commission for Republicans, for Democrats. They get a year to work together, and they have to come up with a proposal that Congress must vote yes or no on. So not just a study, but really something that would be binding. And as I worked with social workers across my county and now my congressional district, they were frustrated because when they wanted to help people, they were often in the position where they were simply administering programs. And they, frankly, by statute, sometimes prevented from doing what they wanted to do, which is person-centered, looking holistically at what are the issues affecting this. And so, Mr. Lucas, when you say there is no clear answer on a solution, I would say that each solution might be a little bit different. You really do have to get to know the person. So I think it's important that we do this reform and we enable our local caseworkers to understand how to use the programs. The other problem is we've got 92 means-tested programs. A fair number of those are housing programs. As I spoke with one of my colleagues, Mr. Cleaver, about this and his experience in Kansas City, some of them work a little better than others. Some of them are easier to get the money spent, and other ones have more rules and restrictions. So the goal here would be to empower the Commission to recommend, without launching any new programs and also without cutting any of the spending, to redesign them so that you could make use of the purpose without as many burdens. 92 programs, a caseworker looking at a bookshelf of 6-inch binders for each of them. The other one is some of them come with benefit cliffs, and you could redesign those. So I'm not confident that we're going to be able to get even one program at a time. Would take 92 years for Congress in a heroic effort. So my hope is that we can find people that are willing to collaborate that. We've found great support through Ohio in our Job and Family Services, through all of Southwest Ohio's United Way efforts. And the goal here is to use Brookings data and do what in the long run will help people is, yes, a job at a wage above the means-tested line, but homeless people are having a hard time even accessing the assistance programs. So I believe passionately that no one should be turned away from these programs simply because they came in through the wrong door. So it's, I think, vitally important we empower caseworkers. Have you seen anything like that work, Ms. Roman?
Well, actually, in Columbus, I think historically, on the homeless side, it's been a very well-organized system that combined resources. There's a big challenge. The homeless system can't solve this problem all by itself, and the mainstream programs that you've referenced have to be part of preventing it and addressing it. And it's very difficult, as witnesses have said, to coordinate those. So I think your help in simplifying them so they can be coordinated but are still powerful and effective would be welcome.
Okay, thank you. And as all of our panel have input, certainly with the housing programs, I think we're onto something. I do have questions about the idea of simply spending more money. The reality is we're spending $10 billion more. Last year we spent about $10 billion more at 3.7% unemployment than we spent back when we had 10% unemployment. I do believe that there should be some correlation, whereas the economy improves, there will be less need. And my time is expired, so I yield.
Thank you. I now call on the gentle lady from California, Ms. Porter. She's recognized for 5 minutes.
Thank you, Madam Chairman. Chairwoman. Ms. Roman, what research or recommendations do you have on how best to cite both shelters, rapid rehousing programs, and permanent supportive housing, and what kinds of services should be provided in order for these programs to be most effective? We're in Orange County's experience as the second highest homeless rate in the country for a city of its size, and we are trying to expand our services. And any insights you can provide on how best to locate those in terms of sizes of shelters, numbers of resources, whether to put them close to schools, transit, jobs, healthcare, all of the above, I would really appreciate your recommendations.
Thank you for your question. I don't have a simple answer for that. There's not, I don't think, a lot of, if any, research on citing. I do think that it's better to cite near transportation and not to separate people. I think that's an important thing. Bigger shelters, there are some okay bigger shelters, but smaller shelters seem to function better. I think one principal thing or two principal things about that, shelters should be low barrier. We're finding that a lot of the unsheltered homelessness is because people won't come into shelters because of the rules, so we need to get them in. And at the same time, you're planning the shelter entries to make that more congenial to people and making the shelter more helpful. You have to, at the same time, be planning the exits. So a lot of places put too much emphasis on the front door, none on the back door, and we don't get anywhere with reducing the numbers.
Thank you very much. Mr. Lucas, in your general knowledge as an American, do we know how to prevent or stop people from getting breast cancer?
Not to my knowledge.
Me either. Okay. In your general knowledge as an American, do we have treatments that can stop the advance of breast cancer and cure individual people?
I believe so.
Okay. I fail to see how homelessness is different. So the research seems clear to me that we know for any given person who is experiencing homelessness that we know that a housing first, permanent supportive housing approach can aid that person or that family and put them on a path to more productivity and better well-being. It is clear to me that just because we do not know how to cure, how to prevent people from obtaining breast cancer, we would not say we should not treat those who are suffering. I fail to see the difference here. I take your point to be, and this is not a question, but I take your point to be that we cannot prevent the occurrence of homelessness merely through supportive housing. We must expand the number of units of affordable housing. And I think that is entirely consistent with what the entire panel has been emphasizing today. So I would just, my view on this is, and I appreciate the witnesses and their thoughtful comments, is we must do both. We must fund, as we do, research to prevent the incidence of cancer, but also treat those who are dealing with its hurtful effects. And I see no reason to be different as we think about homelessness. My question is, with regard to Ms. Oliva or Ms. Roman, either one, in Orange County, we're finding that the heaviest service users are costing us over $500,000, or sorry, about $450,000 a year. And that's about 10% of our population. But if we put those heaviest users into permanent supportive housing, the cost goes down to $55,000. So that is a nearly $400,000 per person savings. When we go to deploy, as I hope we do, a housing first permanent supportive approach, how can we make sure that as these grants and resources go out, that agencies focus on the heaviest users who will most benefit the system from getting permanent supportive housing? How can we incentivize that?
Yeah. So I think that there's a few ways to do that. And the first is to make sure that the folks who need to share data are sharing the data at the local level. I know CSH supports a variety of communities around the country to identify frequent users of systems like the healthcare system or the jails, along with homelessness, so that they can really identify who those frequent users are and target and I mentioned this earlier, the most expensive resource with the highest level of services should go to the folks who are most vulnerable and have the highest level of needs. So, and you can do that through a process that is called coordinated entry. Coordinated entry is something that is being implemented across the country so that people have a fair and prioritized kind of access into the homeless services system, and that there is a system to identify the needs of any individuals or families coming forward.
Gentlelady's time has expired. The gentleman from Tennessee, Mr. Rose, is recognized for 5 minutes.
Thank you, Chairwoman Waters. I appreciate you calling this hearing and the insightful testimony that we've heard today and the responses to the many questions. I'm new to the Congress, and I want to thank the distinguished panel for taking the time to be here. My faith is very important to me, and my faith tells me that the homeless, the poor will always be among us, and that I'm called to lend a helping hand and to take them in. And so that informs my view of this issue to a great degree. I also looked to the Constitution, and as I ran for this office, I often quoted to the people in my district that Article 1, Section 8 enumerates the powers of this Congress. And when I look to Article 1, Section 8, I don't find housing or the homeless as one of the areas that the Congress is empowered to deal with. And so then I reached the view that probably that is a power and a duty that is left to the states and to local governments. And so that's where I would start with this issue, is that I believe I'm personally called, as I believe we all are, to help the poor and to help the homeless. But I'm not sure that that's a duty of the federal government. However, having reached that point, I do think that there probably is a role for the federal government to play. And so, Dr. Lucas, I want to address this to you. It seems to me, as I look at one of the graphics that's been displayed today, that I see that the rate of homelessness, if the data are accurate, is higher in some areas of the countries than others. And if I look, I see that the West Coast and some areas of the Upper East Coast demonstrate a higher rates of homelessness. And I wonder if you could speak for just a moment to the accuracy of that data and whether it informs us in any way about the root causes of homelessness.
Well, thank you for your question. The data that you are describing are the annual point-in-time counts that are published by HUD each year and since 2005, as was mentioned. So what these counts do is they count at a point in time in January each year how many people are homeless, enumerated both in terms of within shelters and then on the street. And that street count occurs through volunteers and social workers and police and communities coming together to attempt to count. So what it tells us is it does give us a snapshot of at a point in time with, over time, increasing accuracy, although there are still challenges with that, how many people are experiencing homelessness on one night. It doesn't tell us anything about the amount of homelessness, the flow of homelessness, if you will, people that are becoming homeless over time. And so those are two different important parts of the data, and both of them vary considerably across communities, as you mentioned, both the prevalence and the rate at which people might come to experience homelessness.
Is there anything in the data or the research that's been done that would explain the disparities in the rate of homelessness across the country?
Well, we certainly have several papers that have linked housing affordability and housing market conditions to the prevalence of homelessness, both within California and then nationwide in the connections to state land regulations as well. So those conditions are there. But at the same time, there's also been some recent work trying to understand the uncharacteristic increases in homelessness in Los Angeles and New York City, which those communities have seen much more homelessness over the last several years, whereas even though homelessness has fallen overall. And the best answers of this, based on economist Brendan O'Flaherty, summarized the literature basically saying that we don't actually know all the reasons why some of these communities have seen the trends that they have seen, despite massive increases in expenditure from federal and local levels in each of those communities to expand the at least targeted homelessness programs.
With the time we have remaining, or I have remaining, is there anything in the data collection arena that you might suggest that we do to help to explain those differences or to gather better data?
Well, one of the things that Ms. Roman mentioned is who is being served in each program and what the barriers are to being served. Certainly, if we have a better understanding of how those programs are operating with the specific people and the needs that are faced by the individuals being served, we can have a better sense of whether or not they are achieving housing retention at rates that are consistent with what we might expect for the challenges that those individuals face.
Thank you, and I yield back.
The gentlewoman from New York, Ms. Ocasio-Cortez, is granted 5 minutes.
Thank you, Chairwoman Waters. Ms. Darley, I sincerely appreciate how illuminating your testimony was, particularly when you highlighted who was in the shelter system with you. Did I hear you correctly when you said that there were doctors and journalists in the Washington Post that were in these shelters with you?
Yes, that's correct. You heard correctly. There were other professions. I remember them because it was so unexpected. But yes, the 3-month stay that I had there, definitely.
So there were people that were gainfully employed that were in this system with you?
Actually, 75% of the homeless population is employed, believe it or not, but because shelters are 12-hour systems where you're allowed in for 12 hours and out, they're not conducive to work.
So 75% of the people in these shelter systems already have a job and they're working?
Yes, a job or an income, i.e. Social Security or something of the like, yes.
And so, I think we've identified several large causal factors, whether it's the racist legacy of our criminal justice system, whether it is women that are systematically paid less on the dollar than men, leaving domestic violence situations that can't afford their own rent, whether it's the great need to invest and improve our child welfare system so that we are not emancipating, as was stated, children into homelessness. And also the great need to acknowledge our nation's mental health and overall health crisis, especially as it pertains to our country's veterans, but really to citizens overall. But one thing that I see is that one big factor that we're seeing that contributes to homelessness is just that the math doesn't add up. Is that wages are too low and rent is too high for a very large amount of reasons. I represent New York City, which is experiencing the current highest rates of homelessness since the Great Depression. And so we've heard a lot about the demand for housing, but we have not heard enough about the supply of housing overall. And one thing that I find interesting is that according to our housing and vacancy survey, there were 250,000 vacant apartments in New York City as of March of 2018. 250,000 vacant apartments, and even at the highest rates since the Great Depression, 63,000 people experiencing homelessness. So that's 4 empty apartments for every 1 person experiencing homelessness in one of the most populous cities in the world. So when we break that down, we see about 80,000 of them are being renovated. 75,000 of them are not even being occupied full-time. And what we're also seeing is that due to deregulations in our housing market or deregulations in taxes, is that a very large amount of high-income foreign buyers are taking up a large amount of this inventory, which is displacing full-time New York City residents, American citizens, permanent residents, and so on, people that are actually living in our community. So my question is and we're seeing also since 2008, roughly 30% of the condo sales in Manhattan developments have gone to purchasers with overseas addresses. So we have local people, our people, who are not housed, and foreign multi-millionaires or billionaires that are having their 3rd, 4th, or 5th home. So I think this is really a question about priorities. And where do we prioritize housing people in America as opposed to giving a foreign multi-billionaire or even an American billionaire their 5th penthouse? So my question is to Ms. Oliva is where are some of the issues that you think solutions that we can point to in addressing that?
It's a really important topic because there are cities across the country, not just New York, who have a very mismatched number of vacancies and the types of vacancies that they have in their city. In the district, we're experiencing that right now. The types of vacancies that are available are well outside of the affordability range for people who are experiencing homelessness in this city. So communities are doing things like trying to figure out how to do shared housing so that families or individuals can go in together on a 2-bedroom unit or a 3-bedroom unit and share the cost of that housing. Other communities are looking at landlord engagement as something that they really have to step up in order to get the number of units that they need over time.
Thank you very much.
The gentleman from Ohio, Mr. Gonzalez, is recognized for 5 minutes.
Thank you, Madam Chairwoman. First, I want to say to my colleagues what an honor it is to be serving with you on this committee, this Congress, and I look forward to working with you on some of the most pressing problems facing our nation. My commitment to each of you is to be a productive partner that will always work to find common ground in improving the lives of our constituents who we are so fortunate to represent. I want to thank you, Madam Chairwoman, for holding this hearing today, and thank you to our witnesses for their testimony and for so diligently answering these hours of questions. So I believe that every person on this committee, certainly in this room and watching on TV across our country, sincerely wants to see homelessness end in America. In nearly every community in the country, we have people suffering from homelessness while passionate citizens and taxpayers work tirelessly to solve the issue. It's not for a lack of empathy or compassion that we have homelessness today. Just yesterday, I visited with a constituent in my office who shared the story of her roommate's family who've been driven from their home and now have to shack up in the dorm with the students. So this is a big problem, and I thank the panel for their work in helping resolve this issue. As with all big problems, I believe we need to start with a compassionate heart and a sound mind that prioritizes evidence and data while addressing root causes as we consider solutions to our challenges. As I review the legislation before us and I look at the publicly available housing data that we're seeing on the screens around us, I see some troubling signs. From 2014 to the present day, we have increased spending by 15% to address homelessness, but homelessness has decreased by only around 4% in that time period, and has actually slightly increased the last few years. Additionally, we see in cities with the highest concentration of homelessness, San Francisco, New York, Los Angeles, that homelessness has increased to truly crisis levels. despite good faith efforts from all levels of government and additional spending. I believe the evidence is clear that simply putting more money at the problem is not the cure-all that we would probably like to believe. The problem is not purely financial. It's structural, it's systemic, and much of the work we need to do exists outside the purview of this committee. My hope is that today's discussion is the beginning of a much deeper conversation that does not start with a pre-baked solution, but that works to identify root causes and impediments that our people face as they seek to avoid and alleviate homelessness across the various communities that we are so fortunate to represent. So with that, my first question goes to Dr. Lucas. Roughly how much do we spend per year on federal homelessness programs, and how confident are you that the additional funding being discussed today would permanently end homelessness in America?
So the U.S. Targeted Homelessness Assistance budget was $6.1 billion in 2018, and that's basically doubled since about 2008 or so, when it was in the sort of right around $3 billion a year in spending. And in the answer to your question, one of the things that's important to remember is that people continue to face challenges that may become homeless in the future. And so even ending it for those that currently experience it will not be sufficient to end homelessness for the rest of our nation, of course. Right?
Thank you. In a 2016 President Obama White House Housing Development Toolkit highlights the impact that local barriers play in reducing housing affordability for working families, specifically in New York, Los Angeles, and San Francisco. The report goes on to say, HUD's existing project-based and housing choice vouchers could serve more families if the per-unit cost wasn't pushed higher and higher by rents rising in the face of barriers to new development. That's a quote. In addition, the city of San Francisco, despite a homeless epidemic, built 17% fewer homes last year than the year before. The California Department of Housing projects California would need to build roughly 180,000 homes per year to keep prices stable. They've built less than half of that. The LA Times wrote an op-ed in May 2018 titled, "California's Housing Crisis Reaches from the Homeless to the Middle Class, but it's still almost impossible to fix." The reason that they cite is because state and local development laws make it incredibly difficult to bring new units online. Dr. Lucas, what sort of impact does local zoning barriers and land use restrictions have on access to affordable housing? And is it safe to assume that a significant portion of the funding within the proposals discussed today would go to states and localities that have these more stringent local barriers?
Well, to my knowledge, the funding allocations have no relationship or are not influenced by the state of local regulations toward housing. The point that you've gotten to is, as was mentioned earlier, there's a difference between it's worth thinking about the demand for housing, but also the supply and the barriers to financing that.
Thank you, and I yield back.
The gentlewoman from Massachusetts, Ms. Presley, is recognized for 5 minutes.
Thank you, Madam Chairwoman, and I thank all of my colleagues for their robust line of questioning. I want to thank the Chairwoman for her leadership, for making this the first issue that we're tackling as a full committee. It is an issue of consequence to all of our districts and certainly to the country. And then I thank each of you for the work that you do every day and for your expert testimony provided. In my faith tradition, we often say, "There but for the grace of God, there but for the grace of God go I." And it seems that increasingly so, certainly in the Massachusetts 7th, the district I represented throughout the country, people are an incident, a circumstance away from experiencing homelessness, a fire away, a medical bill away, a paycheck away, certainly exacerbated by this most recent federal government shutdown. And so it's so important that we, as you've addressed, these are not issues that we can tackle in a silo. There's an intersectionality and a complexity here that does require a holistic and comprehensive response. It was mentioned earlier that we are in the midst of a booming economy, and although there are more people employed than ever before, most of them are underemployed. So are really on the precipice of dire straits economically and experiencing homelessness. Due to the robust line of questioning, a number of my questions have already been asked, so I just want to ask a couple of things that I didn't hear and I hope I didn't miss when I stepped out of the room. So if you have to be repetitive, I do apologize. I wanted to talk about what we are doing to support those who aim to successfully re-enter into society. In Massachusetts, 30% of our chronically homeless are those who were previously incarcerated. In fact, many of them are being released from correctional facilities to shelter. While at the same time, we know that the #1 driver of recidivism is unemployment. And so how can someone make a positive contribution and pursue employment if they do not even have a shelter or a home? I know there are some models throughout the country that are being explored due to discriminatory housing policies that are often barring those who have previously been incarcerated from reuniting with their families, especially if they're in public housing. And so I'm just curious as to what your thoughts are about how to address the needs of this chronically homeless population to ensure that they can get on track to making a positive contribution and not have their hands forced. I think New York had a model. I'm just curious what you think about housing specifically for those reentering.
Well, in particular, for people who have mental health issues or mental health and behavioral health disorders, I think targeting people reentering for permanent supportive housing has been a very effective thing. I think another dimension of that to recognize is that people are often criminalized for their homelessness, and then they get a criminal record, and those records then stop them from being able to get units and also to get jobs. So some way to address the records history and so forth, I think, would also be important.
Okay. And then secondarily, in terms of while people are in shelter and ensuring that those spaces are safe, I know that Secretary Carson had withdrawn a rule that would have required HUD-funded homeless shelters to uphold certain federal protections for LGBTQ individuals. So, what can we do to ensure that HUD is upholding its mission to ensure equal access to safe and affordable housing? And then my question on training for staff in terms of linguistics, cultural competency, sexual orientation, gender identity sensitivity, is that something that could be cost neutral?
To answer your initial question, yes, the Equal Access and Gender Identity Rule, which went into effect in 2016, I think that there have been some of your colleagues that have made requests to Secretary Carson over at HUD about the enforcement of that. There was some resources that were taken down from the HUD website, and there has been a lack of guidance around what that looks like for creating inclusive spaces. We as an organization do a lot of work around making sure that gender pronouns are recognized, that intake forms are representative of people's gender identity. I think that in regards to training, there are free trainings that currently exist. Specifically, my organization has a True Inclusion Toolkit that addresses how service providers can create more inclusive and safe spaces for LGBTQ individuals, so there are resources that exist.
Gentlelady's time.
Thank you, Mr. Rush, and thank you, Madam Chair.
The gentleman from Wisconsin, Mr. Duffy, is recognized for 5 minutes.
Thank you, Madam Chair. Welcome again, panel. There's a number of issues that I want to get to, including zoning. I want you to talk about programs that work and don't work. I also want to talk about foster children. But first, I know it's not up here right now, but I got to tell you what, that beautiful Gerald R. Ford looks a lot like freedom to me. What defends liberty and freedom and democracy for this country and many others in the world. So to say we don't want to have a military to protect that is concerning to me. But that's a conversation about money, right? And if I ask the panel, would you all say the main need here is we need more money? You're asking for money? Yes, is that what you're... Ms. Roman's saying yes, and no one else is taking me up on that. You guys saying money? I'm from Wisconsin, you're talking about cheddar, right? Yeah, you want money. And so, I look at Ms. Darley's story, and I thought it was a remarkable story of success, of hardship. I can't imagine the hardship that you went through when you got the kind of world thrown at you, and you made it out, but you're here to tell the story of how hard it is, and I appreciate that. You think we need more money for these programs, right?
Not necessarily. I'm not saying that money wouldn't help, but I'm a strong advocate for innovation. And that's because I get a chance to talk to a lot of the young people around this country, and they give me crazy, awesome ideas as to how this could some have put into their own plan. One young lady did the coat, which turns into, 19-year-old designed it for the homeless. It's a coat that turns into a backpack that turns into a sleeping bag. So I'm just saying innovative thinking and the opportunity to do so.
You're speaking my language.
Would be the key.
I totally agree. Mr. Stewart, are you a veteran?
No, sir, I'm not.
But you represent a veterans group.
Absolutely.
And do you think we should prioritize veterans over other homeless individuals?
I would say that it has been successful where we have done that across the country.
So you're saying, yes, we should prioritize veterans?
Yes.
Would the panel agree with that? Give me yes or no, quick.
I don't think it's a yes or no question. I mentioned earlier, I think that we need to be able to walk and chew gum at the same time.
But should we, if we have homelessness and we only have so many slots and so much money, should we prioritize the men and women who serve this country? Yes?
Highly vulnerable men and women who serve this country
should be taken care of.
Should be taken care of.
So when we look at our veterans, are they all in homes, or do we have homeless veterans right now?
Our best estimate has that we have 37,878
veterans
given night
that are homeless.
Yes, sir.
So I look at the money side of this, and the point I'm getting at is we're talking about aircraft carriers, right? Let's not invest any more in liberty, freedom, and democracy, my view. But if we were to take, let's say, $45 million and plug it into a state, could that actually do some good for our veterans in a state if we were able to give $45 million for homelessness?
The history has shown that that has been the case, yes, sir.
How about $1.3 billion? Would that help? $1.3 billion in one state.
Yes, sir.
Yeah, so what I'm getting at is, do you know how much we spend on illegal immigration? So why do we prioritize people who don't come here lawfully ahead of our veterans, ahead of people like Ms. Darley who find themselves in hard times? California alone spent $45 million on legal services for illegal immigrants, and we have homelessness in America. Veterans are homeless in America. $1.3 billion, a total cost for 2 years in California, $1.3 billion, and we say we prioritize homelessness? I'm all about making sure we have resources to help people out, but when we have veterans on the street, why don't we take the federal, state, and local money and work on homelessness? You want cheddar, that's where the money's at, isn't it? Let's make sure that we don't have any Americans who sleep under bridges, any veterans who serve this country but sleep on the streets, before we give money for all these other programs. Does anyone disagree with that? Should we put illegal immigrants ahead of U.S. citizens or veterans? Anyone disagree with that? We should put our people first, right? Who disagrees with that? Mr. Rush, you disagree with that?
Again, I want to reiterate that I don't think that this is an either or, and I think that we need.
Oh, it's about money, though, Mr. Rush. It's about money.
It is, and I
it's
think
about having the resources. And if we're looking for resources, why don't we spend it on our homeless first, our people first? A lot of money there. Let's use it for the right purposes. I yield back.
Thank you. Since we're talking about money, the chair takes the opportunity to say that the Trump tax plan added $1.5 trillion to the debt, and in the last 11 months, we added $1 trillion to the debt.
That's because
so
of Democrats'
spending. About money, let's talk about the leadership. That's
more money comes into the federal coffers, Madam Chair. More money comes in with the tax reform.
The gentlewoman from North Carolina, Ms. Adams, is recognized for 5 minutes.
Thank you, Madam Chair, and thank you for convening this important conversation on eliminating homelessness. It is a serious problem, and it's a serious problem in my district in North Carolina, Mecklenburg County, where more than 9,000 experience homelessness on a single night. I'm concerned about the transitional housing services. In my district, countless transitional sites that provide necessary supportive services for residents combating addiction, opioid use disorder, and other chemical dependencies have seen significant reductions or outright elimination of funding. And just last week, the CEO of the first licensed transitional housing facility of its kind in North Carolina, and maybe even the country, reached out to my office for assistance. They've been in the Charlotte community for decades, serving nearly 300 individuals. And they recently found out that HUD will no longer provide federal resources because it's not a permanent housing facility. And I'm troubled by this shift. I want to ask Ms. Oliva and Dr. Lucas, having said that, should Congress analyze and reassess HUD's shift away from providing resources for transitional housing in the continuum of care?
Thank you for that question. And, you know, I would say that a lot of evidence points to, and a lot of transitional housing programs operate in ways that are high barrier and that are highly expensive. And with the budget the way that it is, especially with the Continuum of Care program, where a large percentage of the funding in each year goes to renewal of projects that are already existing rather than new projects, it is really up to communities to prioritize which projects are most effective, which projects are should be not necessarily eliminated, but put lower on the list. And HUD does fund based on a prioritized list that is provided by each community. But the movement away from transitional housing and towards supportive housing and rapid rehousing is really about the evidence and the costs related to those kinds of interventions to ensure that, again, federal funding is being used in the most effective way possible nationwide.
Thank you. Briefly, please. I've got another question. Go ahead.
I'll just briefly note that, so the closest substitute to transitional housing in the sense of being a shorter-term solution is rapid rehousing. And in the available evidence that we have, there actually isn't, in terms of housing retention. Rapid rehousing, there's even less evidence on terms of effectiveness relative to permanent supportive. So it is an issue.
Thank you. To Ms. Stewart and Ms. Darley, in terms of the importance of destigmatizing the issue of homelessness, particularly as it relates to our veterans, despite the overall reduction of veterans' homelessness nationwide, the lack of housing for veterans continue to be a major issue in my district in North Carolina, which is undergoing rapid gentrification. Based on the work that your organization has done to provide technical assistance to local providers, what would you say are some of the ongoing barriers to achieving an end to homelessness among veterans? Ms. Stewart and
Yes,
Ms.
absolutely, Congresswoman. Thank you for the question. Just quickly, my brain is still in your stigma comment, and I'd love to address that. One of the things that I think sticks out in the public's mind about the image of the homeless veteran is sort of an older gentleman, usually a Vietnam veteran, on the street with a sign in old BDUs. And while that population exists, that age of the population exists, it's also important to recognize that newly entering veterans, so newly post-9/11 veterans, are finding themselves at risk and homeless in increasing numbers every year. To include a large section of that population are women veterans. So that's just something I want to put on the record. As far as barriers go, there were a number of barriers. Affordable housing is an obvious one. The coordination of resources proved to be difficult. We had to do a lot of changing and growing as a field, even in the VA-funded side of things. We're talking about transitional housing. VA-funded transitional housing called the Grant and Per Diem program had some growing pains to go through as well. We've found a pretty happy medium there now, and it's part, the smart limited use, the veteran-centric use of transitional housing is part of the federal benchmarks and criteria.
Thank you. I've got 15 seconds. Ms. Darley, would you like to add to that?
I'm part of a group that helps homeless veterans. We find that PTSD, I've ran out of time, but...
I apologize, I have to cut you off. Madam Chair says I'm out of time. Thank you. Yield back.
Thank you. The gentleman from Wisconsin, Mr. Stile, is recognized for 5 minutes.
Thank you. I want to start by thanking Chair Waters for calling today's hearing. Homelessness is a serious problem affecting every community in our country. In Wisconsin, by HUD analysis, we have 5,000 people that are homeless. By the Department of Education's definition, 18,000 youth are homeless. But despite the federal government's sustained and significant investment, homeless persists at unacceptable levels. I visited homeless shelters throughout southeast Wisconsin, the Halo Center in Racine or the Shalom Center in Kenosha, and see firsthand the importance of having a local approach to addressing the homelessness problem. I had the opportunity to meet a young gentleman at the Shalom Center in the city of Kenosha, and he had arrived there fallen on hard times and had been given the opportunity for a job at an Amazon distribution center, a step to get back up on his feet. And that local involvement was critical. It was a local solution that was one of the driving forces for this individual to get back up on his feet, albeit making sure that we have that first step to make sure he had that private-public partnership at the Shalom Center to get there in particular. Dr. Lucas, some of the proposals that we're discussing here today involve a significant increase in money that would spend to address homelessness. We all agree homelessness is a big problem. We should do everything we can to ensure that all Americans have a safe place to live. At the same time, we need to spend taxpayer funds wisely, getting at the best impact we can for every dollar. I believe there should also be a look at whether existing rules, regulations, and practices may cause or exacerbate the problems. I heard from my colleague from New York earlier on the particular high costs of housing in New York City. And it would be amiss to not look at maybe what some of the local housing policies are in certain cities that may be driving those higher costs and having a disparate impact on individuals from those communities that are subject to their own local control and regulations that may be having that negative impact. Could you comment what policies or reforms or new flexibilities may help communities better address this situation?
Well, thank you, Congressman, for your question. Certainly, as you suggested, when we're talking about land use regulations, they come in many forms, right? It's not one blanket thing, but a lot of it requires what you're allowed to use property for. That can include development, but it also can include the renovation or the repurposing of existing properties. So it was mentioned in New York City, there's a high rate of vacant units. In Syracuse, New York, where I live, there are 1,500 vacant housing units. And a comparable number of people in the homeless shelter system, actually. And so questions emerge of what are the opportunities, what are the barriers that make it more expensive to expand affordable housing, which in some ways will price out the development of additional units that are of a lower cost, right? And other regulations about what you can and can't use property for certainly affect that responsiveness of the supply in local communities.
Thank you very much. Ms. Roman, in your testimony, you highlighted some of the differences in rural and urban homelessness in my district in southeast Wisconsin and the cities of Janesville and Racine and Kenosha. We have cities, and then there's also rural areas in between and across a lot of the state of Wisconsin. Do you think the local leaders have the flexibility they need to address some of the challenges, in particular in rural areas?
I would say, actually, while I think the continuum of care works very well in urban areas, there's some improvements that could be made in rural areas. The urban areas have the full infrastructure, the sort of soup to nuts programs. It doesn't make sense to build something like that in every single town. And I think there have been several proposals to fix the continuum of care to work better in rural areas, but I think rural areas need some more flexibility in terms of resources. Could probably house people a lot faster and kind of skip these long periods in the homeless system. Often also tends to be a little bit more affordable housing in a lot of rural areas.
Thank you. I think it highlights the importance of some of the local control and local decision-making that's required to address this problem. I'd like to ask you one more question, slightly different tact. You've highlighted some of the relationship between homelessness and human trafficking. In southeast Wisconsin, there's an Interstate 94 corridor running between Milwaukee and Chicago. Human trafficking, a real significant issue in that area. Could you just comment in the seconds that we have on that relationship? Maybe we'll follow up.
As Ms. Darley has said, that not having housing certainly makes people vulnerable to being trafficked.
Thank you very much. I yield back.
Time has expired. The gentleman from Illinois, Mr. Caston, is recognized for 5 minutes.
Thank you, Chairwoman. My question is for Ms. Oliva. During the recent shutdown, I met with a number of service providers who were at risk of not being able to provide their services if the government didn't reopen. And one of the women I met with was a director of a local YMCA that provided both temporary housing and a domestic violence hotline. And she described in rather heartbreaking fashion how both they are at an annualized all-time high for incoming calls to their domestic violence hotline, which she attributed to the Supreme Court hearings, that was when they saw the uptick come last July. And she also noted in rather clinical fashion that the lethality of domestic assault is on the rise. To put it very blunt, we don't get a second chance to help a lot of people when they have the courage to stand up the first time. And what I'm hoping you could comment on in your role in supportive housing, what more can we do for these communities where housing security is inseparable from personal security and the house they're in is no longer safe? Is there more we can be doing on a federal front on that front?
Right. So the most important thing that we do is that in the definition of homelessness, there's a whole category of folks who are survivors of domestic violence, and they have different standards to get into programs. Like they don't have to provide the types of documentation because usually somebody fleeing a domestic violence situation doesn't have that documentation with them. So ensuring access to a variety of systems is incredibly important. We also need to make sure that public housing authorities and other affordable housing developers understand when domestic violence happens within one of their programs or within one of their buildings, how to address that situation without further harming the survivor of domestic violence. And then I would say that the other really important thing to do is to ensure that all of the different types of interventions that we talk about, shelter, emergency, safe shelter, rapid rehousing, supportive housing, are available to survivors of domestic violence in different ways, and that the services are appropriate for that particular population.
Thank you. My next question is for Mr. Rush. The University of Chicago recently released a report on youth homelessness, I think it was called Missed Opportunities, that found that when the LGBT community, particularly young adults, that I think they have 120% higher risk of reporting homelessness compared with youth who identify as heterosexual and cisgender. Can you help us understand some of the unique needs of LGBT youth who are experiencing homelessness, what programs exist, and what we can do, particularly but not exclusively at a federal level, to make sure that we get that community the protection it needs?
Sure, and I actually referenced that report in my initial testimony. I think that one thing that it does a really good job of, it doesn't just talk about people being kicked out of their homes because of their LGBTQ. I think that's one part and one facet of it. I think LGBTQ individuals, yes, they have to do with transphobia, homophobia, and all of those other things, but when we talk about intersectionality, a black LGBTQ individual or Latina individual has to deal with the intersections of race and their being LGBTQ. And I think that LGBTQ individuals experience housing instability just like everyone else. They have issues with finding affordable housing just like everyone else. I can't think of anything specifically on the federal level as it pertains to HUD that implements programs specifically for LGBTQ individuals. I do know that through the Youth Homelessness Demonstration Project, which has an approach of leaning on youth who have formerly experienced homelessness with a lot of individuals in that end are LGBTQ. They work with continuums of care to be able to come up with a strategy to prevent and end youth homelessness in their locality, and that does have a plan generally to focus on addressing homelessness among LGBTQ individuals, but I do think that there needs to be a further investment on the federal end to target resources, just like targeted resources are provided to veterans and families, that there needs to be the same for LGBTQ individuals.
Thank you. I yield back the balance of my time.
Thank you. The gentleman from Arkansas, Mr. Hill, is recognized for 5 minutes.
Thank you, Chair Waters. Appreciate you calling this hearing. Appreciate the opportunity to hear from this excellent panel. Thanks for your fortitude and sitting still this long. We appreciate your expertise. I'd like to start by talking a little bit about the robust efforts in Little Rock to combat homelessness. It's very well coordinated, and it has a robust engagement with both the city and federal resources and our nonprofits. And today, really in the 2 terms I've served in Congress, I found it very rewarding to see their work where they have an active casework in our office. We go and find veterans where they are. We've solved so many veteran challenges in our homeless shelters. It's been a really rewarding work in our office. I've got 4 veterans on my constituent team. 3 of them are combat veterans, and they spend time in our shelters really helping our vets. They deserve that extra touch, and many of them are really lost in the morass of not only homelessness, but also the veteran programs that they might be eligible for. So I thank my staff for that work. And we've been a vigorous advocate for funding. Just in the last 4 years, we've gotten $4 million in grant funding for our homeless nonprofits in Little Rock, and they are using that money very wisely. And I've been so impressed by, from just really taking care of that emergency transient housing, the person who loses their lease, that family in crisis, that more troubling chronic alcohol and drug addicted population, and then those who are really working their way back to self-sufficiency. All that group works really well together, and that's why I invited Ben Carson to Little Rock to see this work on the ground and see what's happening. And he was really inspired by that work. And we have one of our nonprofits, Our House, which Dr. Carson really encouraged you that they would be a terrific person to lead the Envision Centers for in our public housing. That's an initiative of HUD. And so I hope to see that move forward. But in all the aspects of it, whether it's the Dorcas House, Union Rescue Mission, St. Francis House, Jericho Way, Salvation Army, Gaines, Lucy's Place, Women and Children First, all these, I've been impressed as a former business person to see how well they work together, looking for that gap and filling it to help all those suffering from this homelessness. A couple of questions I've got. One, we've heard Mr. Lawson mention it, my friend from Wisconsin mentioned this issue of definitions. We have all these definitions that are different on homelessness, and it's allowed, I think, the federal government to make claims to ending homelessness, which I don't agree with. We had a celebration where the mayor of Little Rock went out to an event this fall, ending veterans' homelessness, and I'm going, man, I can take you and introduce you to some right now that are homeless. So how do we get HUD and the VA on the same page about the definition of who's homeless? Anybody want to talk about that? Miss Oliva, you worked at HUD, so we have these multiple definitions of homelessness. Is living in a hotel homeless?
It depends.
Well, it really doesn't. You know, if they're in a hotel for longer than a month, are they homeless?
So I would say that there's a need, because of the resources that are available, to prioritize folks that are most vulnerable first for the housing resources that are available. So I don't think that HUD and the VA were not on the same page around, and Mr. Stewart might be able to address this based on something more recent, but our work with the VA, our collaborative work with the VA and USICH around veteran homelessness in particular, was some of the best work that we did inside of the federal government, as far as I'm concerned, because we were on the same page. We ensured that we were prioritizing chronically homeless veterans for the HUD-VASH program, for example. Yeah. And until no veteran was on the street, then we could start working down the list. And homelessness prevention is a part of those programs that could work with folks who are in hotels.
And they do great work in that. Ms. Roman, talk to me about for the vouchers that we have in Section 8, how do we make sure that they really are clean and safe places, that our public housing authorities are really putting those vouchers out where they should be?
Well, I'm not an expert on Section 8, but my understanding is that they do inspections on Section 8 units, and you know, they're supposed to be clean and safe. I think in the homeless arena, you know, we don't always have those kinds of inspections, and you do have to be concerned about the quality. But
thank you very much.
The gentleman's time has expired. The gentlewoman from Pennsylvania, Ms. Dean is recognized for 5 minutes.
Thank you, Chairwoman Waters, and I want to thank you, like the others, for your commitment to ending homelessness. It is, I think, something that government has an extraordinarily important role to play. We can do it if we just put our will and our resources toward it, and if we think in very innovative ways. I want to thank you, Ms. Darley, also for telling us right up front, homelessness doesn't discriminate, and housing must be first. And I'm going to use your quote, if you don't mind, that the opposite of wealth is poverty, and the opposite of poverty is justice, because that's what we're here to do. So I'm inspired by your words, and we can use that to end homelessness. 2 areas that I wanted to look at has to do with the barriers to identifying those who are homeless and actually successfully getting them out of homelessness. And so I was a state representative in Pennsylvania before coming here to Congress. We dealt with homelessness in my district. I worry about the data. I'll just say this as a statement, not as a question, but I do worry about the data. I'm sure all of you do too. We did point-in-time counts in the middle of the night. And we know that it doesn't account for everybody. We know there are people who are on a cousin's couch or sleeping in a car in a parking lot where we're not aware, and so many other things. So I worry about the data, and are we actually capturing the number of people who are homeless? And if we can't fully capture it, how can we ever fully solve it? So that's more of a statement. The 2 areas that I wanted to talk about have to do with barriers to helping those who fall into homelessness, and they have a connection to domestic violence, or they have a connection to addiction. In our city of Philadelphia, as I crisscross the city and I'm racing about, I am so struck and so sometimes paralyzed by the number of people who are homeless, standing on the street begging for a crumb, a dime, a dollar, and you know that they are in the ravages of addiction. So I'd like to know, what are some of the clear barriers to homeless folks who are suffering from the disease of addiction, and how can we break down those barriers, number 1. And then the other one, and so I will open this, I'm certain Ms. Oliva would be one, but others, I'm certain, Ms. Roman and others would help me. We talked about domestic violence. In 2017 in Pennsylvania, I lost my number, 117 Pennsylvanians lost their lives to domestic violence, 2017 alone. The majority of them women killed with a firearm. In the past 10 years, more than 1,600 Pennsylvanians lost their lives as a result of domestic violence. So what are the obstacles for women in particular fleeing domestic violence situations? How can we serve those victims of domestic violence? There is this terrible intersection between domestic violence and homicide when there is a weapon present. How does homelessness actually increase the risk of domestic violence? So I apologize for bowling all of that together, but maybe I'll start with you, Ms. Roman.
I'll just talk about the addiction issue. I would just say 2 things about that. One, we just looked at a bunch of data on unsheltered people living outside from around the country, actually 30,000 records. And one of the big barriers to them going in or getting help is because the high barriers in the shelter system. So an initial thing is the shelter systems have to really be welcoming to people and not screen out people because of their substance use. And the second thing is that treatment is only available, I think the national average is half the time. Only in 50% of cases in which somebody is ready for treatment can they actually access treatment.
Right.
So that's a second piece of that.
Thank you.
And I would agree with both of those things that Nan just said, specifically on people with substance use disorders. We don't have enough for outreach, and we need the right kind of outreach to get folks into shelter, and we need more recovery housing to help folks who have those kinds of substance use disorders. On the domestic violence side, technology has made it less safe for programs that have physical shelters. Now you can go on Google Maps and you can identify somebody's car that's sitting in front of a shelter. So the domestic violence, sort of group of folks who are working on domestic violence issues nationwide are really need to implement new technologies and be innovative. They also have to really work between the domestic violence system and the affordable housing system and the homeless system. And that can be done, and it's being worked on.
Thank you very much. And I also want to talk about the problem of qualifying as homeless. In my own county of Montgomery County, Pennsylvania, we have a system that we call into called Your Way Home. I sat on the phone with somebody who was struggling and going to be homeless. It was a 60-minute call, and they didn't qualify because their eviction was maybe 2 days away. So I just raised that. Thank you. Thank you, Madam
Gentlewoman's
Chair.
time has expired. The gentleman from Ohio, Mr. Stivers, is recognized for 5 minutes.
Thank you, Madam Chairman. I want to thank you for holding this hearing, and I want to thank you for your leadership on fighting homelessness. And now to the witnesses. Ms. Olivia, I want to do a follow-up on a question that Mr. Hill asked a little while ago, and I'm going to do it as a simple yes or no question. Are you aware that the Housing and Urban Development definition of homelessness excludes people under the age of 18, while the Department of Education does count homeless folks under the age of 18?
I don't believe that that is a correct
It
statement.
is true. Sorry, it is true. Mr. Rush, since you're the only one who's actually mentioned youth homelessness, I'd like to ask you about something. Just yesterday, the Department of Education released a report on youth homelessness that showed that homeless youth have actually increased. And in fact, in 20 states, that homeless youth growth has been over 10% a year in the last 10% over the last 3 years. So obviously schools identify these folks because they're at risk, and so there's a good reason for them to count them. But the Housing and Urban Development definition of homelessness actually excludes those folks from getting shelter. Mr. Rush, don't you think those are among some of the most vulnerable people who could be homeless?
I do think that there's a risk of experiencing homelessness, and I think that the HUD-funded programs may or may not be the best solution to address those problems.
But shouldn't we be counting them?
I'm a believer that data and additional data is needed, yes, specifically as it pertains to most impacted populations, yes.
And these are some of the most, potentially some of the most vulnerable population out there. So I've had a bill for the last 3 Congresses to force Housing and Urban Development to count, to change that policy, to count homelessness under the age of 18, and it's a bipartisan bill. We're continuing to work on it. We worked with the chairman on it last cycle. Ms. Beatty and I are the lead sponsors of that bill. We're going to keep fighting for that, and I hope all of you will pay attention to that, and I really appreciate everything all of you are doing, but it is a very important issue to the future of our country and to a lot of young folks who are very, very vulnerable. The second issue that I've been focused on is veteran homelessness. And Ms. Stewart, I do appreciate that your testimony focused on the other than honorable discharges. As a military veteran myself, sorry, Mr. Stewart, these are the folks that are most likely to be homeless. They're also most likely to have other conditions that aggravate that, whether it's drug addiction, mental health, physical health issues. And you talked about a change last year in the 114th Congress that allows the VA to serve part of that other than honorable population. But can you describe to us, because my understanding is there's still a bunch of people that are left out that are not eligible even under that expansion?
Excuse me, that's exactly right, Mr. Congressman. What the previous bill, PL 114315, did was make veterans with other than honorable discharges and eligible for VA homeless services to include grant and per diem, supportive services, and the like. But it does not include eligibility for HUD-VASH. Your bill and Ms. Beatty's bill would do such a thing.
Correct.
So it's the same group of people for slightly different services.
Great, and I think the goal is to make sure that even when somebody had a mistake that ended their service, that doesn't mean they should be sentenced to be homeless for the rest of their life.
That's exactly right, sir. These are veterans. These men and women are veterans, and they deserve to not be left behind.
Thank you, and I appreciate that, Mr. Lucas. You talked a little bit about, with your perspective as an economist, what's going on in multifamily housing, and I'm interested in your thoughts of what's going on with the Americans with Disabilities Act and the Fair Housing Act, with regard to some frivolous lawsuits that frankly aren't even causing technical fixes, they're just getting money. And is that having any impact on cost of housing? Is it ultimately resulting in tenants paying higher rent? Is it exacerbating a lot of these conditions?
That's something I'll have to follow up with you, and I'd be happy to do so.
Thank you. Thank you. Madam Chair, again, I really appreciate you holding this hearing. Homelessness in America is something we all should care about. It's a bipartisan issue, and we want to work with you to try to find solutions. I yield back the balance of my time.
Thank you very much. The gentleman from Utah, Mr. McAdams, is recognized for 5 minutes.
Thank you, Madam Chair. Salt Lake County, like many urban areas, and it's great to see some of you. I've worked with you in the past in my previous capacity, but Salt Lake County, like many urban areas, has struggled to understand and address homeless challenges, and we've made progress in many areas and still struggle, like all metro areas, struggle in other areas. Our area has recovered from the economic hardships largely of the Great Recession, and other factors, though, like the opioid epidemic, have meant that thousands of Utahns live on the streets without a safe or a stable place to call home. Many of these families with children are homeless youth, and it's unacceptable that the only home for a young child sometimes is the family car or a homeless shelter, or a teenager is forced to couch surf with friends and relatives, many of them aging out of the foster care system while trying to make their way through school or to train for a job. So when I was the mayor of Salt Lake County, I convened a broad group of stakeholders who in one way or another are part of our homeless service system, whether they're government, city, county, state, supporters of the homeless services system, the businesses and nonprofits, philanthropic supporters, the medical system, education leaders, homeless services providers. And we worked closely with other political leaders, our Lieutenant Governor, our Speaker of the House, Republicans and Democrats working together to try and move forward solutions. And for nearly 3 years, we mapped what we called the genome of our local homeless services system. We looked at every aspect of how, when, where, and with what resources our homeless services system interfaced with individuals who were experiencing homelessness and what we might do to help to resolve the situation. And that plan that we developed through that process identified specific outcomes and indicators by which we would measure the results of whether we're making progress towards our goals of minimizing homelessness. We contracted with mental health providers and transitional housing agencies for 2 pay-for-success projects, data-driven and evidence-based contracts funded by the private sector, who would only be repaid if participants in the program achieve success. And our coalition, what we were moving to is more of a rather than a one-size-fits-all solution, but more of a custom-tailored approach with wraparound services that we help to lift people out of homeless services and identify, I think you've met one homeless person, you've met only one homeless person. Their situation and challenges differ from person to person, and recognizing that we need to meet them where they are and then help them to move forward and achieve a greater degree of independence, a greater degree of self-reliance. And those outcomes are going to differ from person to person. So I guess my question for the witnesses, thank you for the excellent written testimony and your work that I'm very familiar with over many years. My question would be, and referencing Mr. Stewart in your written comments, you said that, in your comments, that housing first never means housing only. In Utah, we have experience with housing first, and I think it's been successful, but we're also seeing that it's not housing only. We need other solutions. Later in the testimony, you go on to elaborate that the HUD and HUD-VASH program utilizes veteran-specific Section 8 vouchers coupled with case management. So I guess my question is, how important has the case management piece been of that? What can we learn from that we might extrapolate to other categories of homelessness? And then for all of the witnesses, what have we learned, or what more can we do in the area of wraparound services?
So I think the HUD part and the VASH part are each equally crucial. The housing first approach works wonders when you get a person into housing. and then wrap those services around them, offer them all the services that they may need. Even if they don't take it right away, studies have shown that they will eventually avail themselves of those services and resolve some of the issues. The case management support through the VA is critical. Making sure people meet medical appointments, seeking employment if able and willing, qualifying for income supports, broad base of issues, and a real model for what we could be doing elsewhere.
And I think that model is incredibly important because the VA and the services don't have to be in the housing program. The housing subsidy can be by itself, and the services can be coming from mainstream resources like Medicaid or the VA or other mainstream services.
And just briefly, the advantage we have on the veteran side is we have a partner who delivers the services. HUD is not a particularly good service deliverer, so it'd be good for the committee to work on finding a partner, strong partner.
I would just add one thing.
The gentleman's time has expired.
Thank you, Madam
The
Chair.
gentleman from Illinois, Mr. Garcia, is recognized for 5 minutes.
Thank you very much, Madam Chair. To all of the panelists who are here, thank you so much for giving us a much better sense of the homelessness challenge that we face as a nation. I would, most of you emphasize the racial disparities that exist among in the homeless population across the country. And I want to highlight an important segment of this. Latinos, while comprising about 18% of the population nationally, comprise about 22% of people experiencing homelessness. So, and I think, Ms. Roman, in your testimony, if I heard you correctly, you stated that Latinos are increasingly experiencing homelessness disproportionately. Can you elaborate on what might be driving this new trend that is being felt acutely in Latino communities in particular?
I'll tell you the truth, I'm not certain what's driving it. Hispanic and Latinx percentage of homeless people has been, it's been disproportionately low in the past. And it's something that's changed. I think we always hypothesized that people were more willing to share housing, and the situation there may have changed. I don't think we have data on why that is changing that I know of.
How might we get a better sense of that? What kind of information should we be?
I think it would be good to ask HUD to actually look into that. It's probably qualitative kinds of information we need to get, and looking at the household, types of households that are accessing the shelter system and so forth. It may have also been that people were just averse to using the shelter system, and for some reason that's becoming a more common thing. I honestly don't, it's a great question. I wish I knew the answer to it.
Okay, well, thank you for your candor. A second question to Ms. Roman. Over 64,000 people in Chicago are estimated to be doubling up, and there are huge disparities among this category of people as well. Approximately 55% African American, 33% Latino. Can you explain the challenges that the so-called doubling up that community faces, and why the data is not reflected in some of the HUD estimates that were discussed today?
So the HUD data on homelessness is not perfect. The point-in-time count does not look at doubled-up households because it would essentially have to do a census, which it can't do. So in the HUD definition, if a household is doubled up, but imminently the second people have to leave, they are homeless, but they don't necessarily get counted. There are also a lot of doubled up families that are doubled up trying to not be homeless, not to enter the shelter system, to stay out of homelessness. And there has to be a little bit of a line somewhere there, and exactly where you draw it, we might disagree on. But some people are stably housed in sharing housing, and some people aren't and really are homeless.
Thank you very much. Madam Chair, I have in my booklet a report from the Chicago Coalition for the Homeless, and I would ask if this can be submitted as a part of the record for the purposes of sharing this with people who are following the hearing today.
Without objection, such is the order.
Great. Thank you, Madam Chair.
The gentlewoman from Iowa, Ms. Axney, is recognized for 5 minutes.
Thank you, Chairwoman Waters and Ranking Member McHenry, and to our distinguished panel for being here. I appreciate it. Just like to start by mentioning that earlier in this hearing, my distinguished colleague, Mr. Rose, questioned the constitutionality of Congress to assist with housing of the homeless. I would state the opposite. Article 1, Section 8 of the Constitution grants Congress the power to lay and collect taxes, duties, imposts, and excises to pay the debts and provide for the common defense and general welfare of the United States. By and large, it is for Congress to determine what constitutes the general welfare, and I would say that adequate housing benefits our general welfare. So on to my questions here. Earlier in the hearing, Ms. Oliva mentioned that there has been decreased federal investment to address homelessness over the last several years. Further, according to the U.S. Department of Housing and Urban Development in 2018's annual homeless assessment report, homelessness increased for the second year in a row. So my question is to you, Dr. Lucas. In your paper, The Impact of Federal Homelessness Funding on Homelessness, you said on page 1, I find that funding increases the incidence of total homelessness. This is diametrically opposite to what the data suggests. So could you provide us with the evidence that you have that supports your theory?
Sure. So that's actually just a statistical econometric finding and not a theory at all. The question that I asked in that paper was whether or not we could discern, using econometric methods from a research standpoint, whether or not communities that get more federal funding through the COC and ESG grants had lower rates of unsheltered homelessness or of total homelessness. And typically, and the result that I found using the methods that allow me to identify actually a causal effect rather than just a correlation, was that communities that got more funding had higher rates of homelessness as counted by the point-in-time counts.
Can you give me an example of that?
So a big portion of that result is driven through the sheltered population, in part because federal funding has allowed communities to expand their shelter supply. And so,
appreciate that. Would you be able to cite a specific example, a city, a location? As you mentioned, you went through the formula, and that's what your evidence found. So what would be a specific, exact location where you saw this happen?
Well, New York City is a place that has significant federal and city-level funding for the shelter system. It's a bit of a unique system, but that's an area that's seen increases over time, not just at a single point in time, in sheltered homelessness over this period, despite increases in funding on the overall over time.
Okay, so you're suggesting that your theory says that the increase in support of helping our homeless population in New York has increased the homeless population in New York.
What I have is not a theory at all. Again, it's just a finding of a statistical relationship over all communities at a given point in time. Okay. And certainly it's been the case that we have seen over time in the aggregate at the national level reductions in homelessness according to our point-in-time counts. Okay. But the evidence that we have suggests that the role of funding that's being targeted to, especially, for example, permanent supportive housing units, has had a relatively small effect at reducing those homeless population numbers. So there may be other reasons.
Okay. You also suggested that local community involvement and support is key, and I obviously would agree that we need to have multiple avenues to help us address this issue. And I'm from Iowa. A lot of people wouldn't think we have a major homeless issue there. I represent one of the biggest metro areas, and we actually do. I am very involved with our Catholic Charities, our St. Joseph's Family Shelter, our Hope Ministries. I also contribute to those organizations. And we have a very serious issue with our police force as well. We're understaffed, and they're consistently helping out with our homeless population. So as much as I would agree that we need to make sure that we've got a systemic approach to homelessness, how would you address those police officers who say that when you tell them that we need to remove aspects of the homeless safety net?
I think I would have to get back to you on that question. I thank you for your involvement with this issue.
Thank you.
The gentlewoman's time has expired. The chair wishes to advise members that floor votes have been called. We do have another hearing at 2 p.m., so I'm so pleased that we had such robust attendance today. And to all members who did not get the opportunity to ask questions, you will get the first prior at the next full committee hearing on housing. I don't want you to miss 3 votes. Plus a moment of silence. So I'd like to thank our witnesses for your testimony today. We're not going to attempt to hold you over for another hour while we go vote these 3 votes and on the floor. So without objection, all members will have 5 legislative days within which to submit additional written questions for the witnesses to the chair, which will be forwarded to the witnesses for their response. I ask our witnesses to please respond as promptly as you're able. So without objection, all members will have 5 legislative days within which to submit extraneous materials to the chair for inclusion in the record. I thank you so much, and this hearing is adjourned.